Friday, July 3rd, 2020, 2 p.m. The regular meeting of the special meeting of the City Council will be called to order. Members, if you would please rise if you are willing and able for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. July 4th. As we open the meeting, I want to first thank staff for coming in on your day off.
I'm not able to hear him.
Are we able to, are we having technical?
What do I do?
You might be muted. Are we good? Okay.
There.
Thank you. So first I want to thank the staff who have mobilized on their day off to accommodate us for this special meeting. This is something I think none of us wanted to do. I know many people had plans. I know I had plans. However, we also know that this is a once in 100-year pandemic that has taken more American lives than literally anything we faced. And we also know there's a correlation with the spread in large gatherings. So the day before the 4th of July is when this is supposed to take effect according to the governor's order. So the emergency meeting by the county commission prevented that, forcing us to respond in due time, and which is why we're here. So I really can't thank staff enough for mobilizing and ensuring that we can have this meeting. And I also want to thank my fellow council members for being here. I know you all have plans as well. So with that, we will call the meeting to order. I have organized the testimony we're going to talk to proponents, opponents, neutral testimony. We have members of the medical community who are on. We have a county commissioner who is with us who would like to testify. We have members who will be at Century 2 who would also like to testify in public forum. And I believe we might have got a few emails and contacts through our social media, as I think the public is very interested in weighing in on this. Just for a point of parliamentary procedure, is Jeff Blubog, Councilmember, is he on?
Mayor, I was going to mention that you may want to recognize, it looks like as if he is participating by phone. I see that you may want to ask, but I believe he is on.
Councilmember Blubog, are you able to hear me? All right, well, he's at the lake, so maybe he's responding with guitars.
Yeah, he just responded.
Very good. All right, thank you, Councilmember, and very much appreciate you taking the time to be in on this call. So with that, the chair will recognize the Honorable Lacey Cruz from the County Commission to give testimony in response to the ordinance requiring the wearing of masks or other face coverings. Well, actually, I believe the clerk needs to read the call of the meeting, so please, I apologize. Madam Clerk.
Reading of the call for the meeting of the city by the city clerk. I'm not really sure if this is correct, but I will read it. Pursuant to City of Wichita Code Section 2.4.210, titled Special Meetings, I, Brendan Whipple, Mayor of Wichita, hereby call a special meeting on July 3rd, 2020, to take place at 2 p.m. in the City Council chambers. The objective of the meeting is to discuss and vote on an ordinance concerning the mandating the use of masks and face coverings in public.
That is correct. Did every member have a chance to receive a copy of the ordinance?
Yes.
Very good. Seems like every member has. With that, the chair again recognizes the Honorable Lacey Cruz of the Sedgwick County Commission and of the Sedgwick County Board of Health. Welcome.
Thank you, Honorable City Council members. Today, I come to you as a member of the Board of Health, as a colleague, as a constituent of District 6, as a mother of an essential worker, as a mother of a school-aged child, and above all, as a friend. I know firsthand how hard this decision before you will be. But I come today because I ask you to vote to protect the health and well-being of the most vulnerable in this community. I come to you to ask you to vote to support your local health department, who is overwhelmed and understaffed. I ask you to vote to support the medical community. I ask you to vote to support your hospital systems. I also ask you to vote to support our business community, both large and small. I ask you to please put aside personal relationships within the council. I ask you to please put aside how this meeting was called, because I know it was very, very last minute. But I ask you most of all to vote for a common sense solution, because wearing a mask is an easy way to protect others, most importantly, the most vulnerable in our community. As I've said many times, we only have so many things in our toolbox, and wearing a mask is a temporary solution, but burying a loved one is a permanent one. I know that is an extreme example, but what's in front of you right now, again, is a common sense method of preventing a worst case scenario. Please vote for one of the few things that we have in our toolbox to slow this spread. I appreciate your attention today. I appreciate the staff being here because I know that we all want a day off. I thank you for your leadership, and I just want to empower you to make one of the most important decisions probably so far on this council. Thank you so much for your attention. I appreciate it.
Any questions for the conferee? See none, we thank you.
I'm sorry.
Is there a question? Oh, sorry, I'm looking at my, apologies, my tablet doesn't seem to be, let me. The chair recognizes Councilmember Fry for a question of Board of Health member Cruz.
Thank you, Mayor. Commissioner Cruz, thank you for being here. I've been out of town on vacation, so I was not privy to the county commission meeting on Wednesday. What was the action that the county commission took?
The action of the Board of Health was to recommend mask wearing.
Was that that was the entire order?
So in order for the Board of Health to overturn the mandate that the governor put down in her executive order, we had to have some findings, and it was found that we only recommend, that was the action taken.
So it was a recommending to wear masks, not a mandate, but to recommend to wear masks.
Correct.
Thank you.
Madam Commissioner, just a follow-up. My understanding is the county commission made a recommendation to finish the Ad Astra program instead of having it mandated. Wondering if you could tell me about the success of mandates versus recommendations.
Well, as we can see, over the past week, we've had over 170 new cases over a 24-hour period. We see that recommendations don't work. If a recommendation did work, we wouldn't see the spike in cases that we've seen thus far.
The county health officer and Dr. Benz both refused to be here today. Hopefully they're enjoying the day off, but according to the testimony that was reported in the Wichita Eagle, the county health officer, I believe her name is Adrienne, described the COVID-19 cases as exploding. Can you confirm that?
Well, I mean, if exploding means that cases aren't, I mean, over the past month or so, each day we've seen cases in, tens and 15s. But over the last week, we've seen hundreds. At our health department, we have, lines are backed up. The health department staff is completely overwhelmed in the sense that we cannot return phone calls. We just don't have enough staff to handle the volume. We had to suspend our asymptomatic testing, quite frankly, because we just didn't have enough staff to handle the influx of people wanting to be tested. We want to test folks, and we have the ability to test them, but with a backlog of cases, or a backlog of people wanting to be tested, but not enough staff to handle that. And quite frankly, our health department has been working day and night for months now. It's very unfortunate. We are trying to hire folks. So if anybody wants a job working at the health department, I would please ask you to fill out an application because we need all the help we can get.
And I'm the recipient of 2 of those tests, by the way. I can attest to the hard work and dedication of our health staff. I do want to just make it crystal clear about the idea versus a recommendation on if it's working or versus a mandate. You and I are on the calls with the hospitals. Those calls, some of the details, they ask us not to publicize. But can you confirm my memory that they have asked for mandates to be put in place?
Well, I'll just read the email that we received yesterday, and specifically for Councilmember Fry. I did read this yesterday. So every commissioner receives the update from the hospital calls. And yesterday I asked, because we were having a special meeting, what were the cases today? And so I'll just read it. In addition to Wesley's 12-plus cases in the hospital, they have 1 case that is admitted as a patient under investigation. Their Monday numbers were 6 positive cases, 6 patient under investigations. I do not know what the % of ICU is, and I see that we have a bunch of hospital staff on today that could probably help us with that. Via Christi reports 15 COVID positive cases today and 1 patient under investigation. Of the positive COVID cases, 13 are on the general floor and 2 are in the ICU. There are 13 available floor beds today and 8 available ICU beds. I guess I'll just cut to the chase, because Bill at Wesley Medical Center says at the very bottom, he says, "We are up 12 positives and we are getting very concerned. The governor's executive order needs to be emphasized by the county commissioners. Everyone needs to wear a mask in our county starting immediately."
So this was the president of which hospital?
Wesley.
Wesley president has sent the county commission an email asking firmly that a mandate gets put in place so they can protect our community.
That's correct.
And again, just to be clear,
Chair recognizes Councilmember Fry.
the county commission voted to overturn the governor's order and mandating masks. And that was 3-2, and the 3 in favor of that were which commissioners?
Chairman Meitzner, Commissioner O'Donnell, and Commissioner Dennis.
Okay, so you're not speaking on behalf of the commission right now.
I am not speaking on
Okay, thank
behalf
you.
of the commission. I am speaking on behalf, as a member of the Board of Health, and I'm speaking on my own. Nobody asked me to come today. I just want to make that clear. I'm speaking because I spoke out yesterday, and that's the reason why I'm here, because I feel like this is such an important topic that I really wanted you to hear from me.
Again, I wasn't privy to yesterday's meeting, so. I
It's
didn't know
riveting.
exactly.
You should watch it.
It's not riveting, but you are most welcome in this chamber, and we appreciate you being here. I just want to confirm that the Eagle did record this correctly. It's a quote from the county health officer and the health director, county health officer and health director, Adrian Burns, and it's quote, "In the last 24 hours, we have added 170 cases." So it is just exploding. Unless there is some kind of intervention, we do not anticipate that number to decrease. In your memory, we still have 4th of July weekend to get through. In your memory, is that an accurate quote?
That sounds right.
And just one last question, and then we'll turn it over to the medical professionals who are here to provide testimony. On our calls and on your emails, it seems like when there is a holiday or a day in which our culture traditionally gets together with other folks, 2 to 3 weeks afterwards, we see a bump in the numbers.
Yeah, what we see today is what happened 2 weeks ago. What we'll see in 2 weeks is what happens today. So we're not really going to be able to tell what happens this weekend until 2 weeks from now. That's the science behind, and I'm sure our medical community can speak to that a lot better than I can.
Of course, and I just want to confirm that on our call, there was a bump from Mother's Day. And the trend is that we continue to see, without masks being worn, without precautions in place, bumps in the numbers 2 weeks after our public gatherings. And that the medical community has made it clear on our calls that because it takes 2 to 3 weeks for this to show, if we wait until those numbers, if there's a run on our hospitals, it's too late by then. I remember asking that question, and that was my response, it would be too late to act at that point. Do you remember that? Could you confirm that? And then we'll let you
Yeah,
go.
I mean, I think the one thing that I would really like to hear is, and I want to remind people, is we don't know enough about this yet. And the effects, I mean, people keep saying our hospitals are going to be overrun. Well, what about the health system in general? I mean, our health department, they're reaching out to me. They are asking for us to do these kinds of things because, quite frankly, we just don't know enough about this disease. And things, I'm nervous about what's going to happen, which is the reason why I'm standing in front of you today. Again, nobody asked me to come. I wanted to speak to you from me to you.
Councilmember Claycomb.
Thank you. I just wanted to say, Commissioner Cruz, thank you for being here. For those who did not watch the Board of County Commissioners meeting yesterday, I thought you had a very thoughtful discussion. I know it didn't come out the way that you wanted, but I was impressed with the questions that the county commissioners asked, and I really thought they were thoughtful. Before that meeting, you also had a business group meeting, and I was very impressed with that meeting too. Again, another 2-hour meeting, and those businesses had, I thought, really compelling practices that they were using. I was quite impressed. They didn't all agree,
Right.
obviously, and I thought that I take issue with how the Eagle reported that today, because that was not my take on how the meeting went. I thought everyone had a plan, and some of them, they were all different, depending on what industry they were. But I just want to thank you for being here today and for the thoughtful discussion yesterday.
Well, thank you. And that's the hard thing. I mean, there's so many different sides of the coin. And at the end of the day, erring on the side of caution, I think it has to be, in my opinion, the most important part of this. So I appreciate it. If you guys don't have any other questions.
Thank you,
Thank you.
Madam Commissioner. We'll now turn the floor over Dr. Steinschauer, I believe, and I'm sure I butchered that name. Doctor, are you with us currently?
Yeah, I'm here, as are a whole slew of other people.
Excellent. Well, I was going to allow you to give a presentation, and then we will start going down the list that you've provided us of members of the medical community who would like to present to us today. So the floor is yours.
Thank you for letting us participate today and kind of provide some of the medical view of what's going on. What we know about what's going on with COVID right now in Wichita is that our case numbers are increasing, and they're increasing at a rapid rate. We have curves that mirror those in Phoenix or Houston, but because we're a smaller population, are slightly lower in number. Our percent positive test rate as of today per Sedgwick County's dashboard is 7%. Phoenix's percent positive is 12%. At the beginning of June, our percent positive rate was 1.6%. By the middle of June, our percent positive rate was still under 3. It was 2.9%. So the rate of spread in the community is increasing rapidly. We are testing more, and obviously there's a concern that we're finding more positives because of this, but this outpaces the number of tests that we're doing. So even though we're testing more, a higher percentage of each of those tests is positive now. With that, we're seeing more cases come through our healthcare facilities. So we're talking our clinics, our hospitals. We're having more people being pulled out of their work because of this. So it's creating economic impact in the sense that businesses are having to close. We've seen that with some restaurants in town. We're also seeing it where workplaces are losing their staff during quarantine times. Hospital numbers will be delayed from your cases. So as our case numbers are starting to climb, our hospitalization rates are going up at a slightly delayed time frame. And our severe illness and death rate will be, again, slightly delayed behind that. So each of these numbers now, we're at the early part of this curve. This is our chance to change that. So looking at what happens in Phoenix and looking at what's happening in Houston, we want to avoid that. They have allocated their scarce resources plan, which means they're having to choose who gets care and who goes on a ventilator because they are running out of resources and they're running out of healthcare equipment and staff. We want to avoid getting to that place. And so one of the easiest ways that we can do that is to social distance and mask and good hand hygiene. We can see a 1% decrease for every 15% of people wearing masks. There's also been financial analysis of this, and by increasing mask use by 15%, we can reduce GDP loss by 5%. So what we can do is make a huge economic impact on our community by increasing our mask utilization. We've tried to ask, we've tried to suggest, and we've seen that we've had a mixed response in the community to people wearing masks. I think we're all really happy to see that more people continue to wear masks as we get our message out. But what you see in communities that mandate wearing masks is that the numbers go up significantly and it changes their course of disease in the community, and it reduces how many people get the disease, and it reduces the burden to both the businesses in the community and the healthcare system.
Is there any questions for the conferee? Doctor, would you just give us your background real quick for the record and for those who might not be familiar?
I'm Chloe Steinchauer. I'm a pulmonary and critical care physician. I am in both private practice. I am also the medical director for the ICU and critical care services at Wesley. My specialty is obviously lung disease and intensive care patients. So these are the patients that I take care of on a regular basis with regards to COVID.
We just learned from the county commissioner that the president of Wesley Hospital has requested that a mask mandate get put in place. Would you say that that is a common agreement among your colleagues at Wesley?
So Wesley has a committee, as does the Ascension Hospital, to get multidisciplinary groups together to talk about what's going on and how we best work in our hospital and how we best work in our community. We have universal masking within the hospital, which means that everybody who comes in wears a mask. So we feel that's a strong policy for safety for our staff. We feel it's a strong policy of safety for our patients. And we support that in the community because it reduces our exposure, particularly with cases coming in through the emergency department or cases coming in for surgical procedures that are previously, they're either not symptomatic at the time, but they're still shedding virus for people to be contagious, or they are early symptomatic, which means they don't really know they have it yet, but they can infect those around them. So we feel it's the safest thing for our community for broad masking policies.
That would be mandated, not just suggested.
Correct.
Thank you, doctor. If there's nothing else to add, is there any questions for the conferee? See none. With that, I will recognize Dr. Rebecca Reddy, who is, I believe, works in pediatrics, and I will just let the conferees know that we give you 5 minutes. It's at the chair's discretion to let you go longer, but if 5 minutes is usually what we try to keep it around, of course. So with that, Dr. Reddy, the floor is yours.
Hello, thank you for allowing me to speak today. My name is Dr. Rebecca Reddy. I am a private practice pediatrician, founder of Red Bud Pediatrics, and my colleagues and I, there are 8 providers in total. We care for 7,000 plus children in the Wichita community. Our office group also actively participates in a group that we call Kansas COVID work group for kids. And part of our recommendations from the COVID work group is on how to safely return to school for all the children in our community. Our recommendation has been in agreement with the American Academy of Pediatrics for the past several weeks since they released their recommendations that kids return to school in person as much as possible, and that children in 6th grade and younger down through pre-K return without masks, but that all staff remain masked. Children in middle school and high school return to school and wear masks pretty much throughout the entire day, because we know that this works. And we're asking this of the children of our community, and yet there's inconsistent messaging in the community for what we are requesting of the adults. And I think as a physician and a scientist, and also as a pediatrician, I consider myself a public health advocate, because we are the ones who are responsible for vaccinating children in our community. I strongly support just a universal mandate on masks so that we can protect one another and slow the spread. I'm very concerned that our children and the entire community will not be able to return to school on time if we don't flatten our curve. And I don't see another way that we can effectively do that as a population other than to mandate masking. And I also, as a lifelong Kansas resident, feel that this is very much consistent with our attitude and vibe. I don't think that, in my own perspective, there are that many people who strongly object to wearing masks. In my own practice, with just a recommendation that they come to our office in masks, we have at least 75% of our parents and families who wear masks if we ask them to, because I have a vulnerable child in my practice. At the time, everyone is willing and happy to put on a mask. So I'm somewhat dismayed that there was not a mandate that came from the county commission, because I see that my patient population, which I consider very diverse and broad, was largely in favor of mandatory masking.
So according to, as a scientist, the numbers and the curve that we are projecting, if we continue on the current path, do you believe that COVID will be subdued enough so that kids could return to school if we weren't to follow the medical advice and mandate masks?
So if we do not mandate masks and we don't follow the advice, our curve will continue to increase at an exponential rate, and we will not be able to return to school. We will not be able to have high school football games. We will not be able to have just normal routines and activities of kids who attend school. And furthermore, I think if everyone thinks about it, they start to recognize that return to school is kind of a linchpin of how our entire society functions socially, as well as economically, emotionally. There's a lot of families who are distressed and they really need a return to normalcy. There's a lot of parents who need to return to work, and yet they have not been able to work at full capacity because their kids are home from school. So this is not just a children's issue. It is a family need, a very strong family need in our community to squash the COVID curve so that we can all return our families to a semblance of normalcy, which includes going to school in person.
Any questions for the conferee? See none, we thank you, Dr. Reddy.
Thank you.
Thank you. With that, I will recognize Dr. Jacob Ott, who is a specialist in emergency medicine. Dr. Ott? There's a good chance I messed up your name, and I apologize.
Council members, thank you. Thank you for having me here today, and thank you for making time close to this holiday to talk to us. I'm an MD and a fellow of the American College of Emergency Physicians, and I'm the medical director at Wesley Medical Center Emergency Departments. And just to echo Dr. Reddy and Dr. Steinschauer, yes, we are seeing a lot of new cases, probably fallout from both Mother's Day and from Memorial Day weekends, and from the lifting of the stay-at-home orders previously. And I believe it's just the tip of the iceberg at this point. If you look at the Sedgwick County COVID dashboard, which I look at almost every day, you're seeing a steep increase in the curve of new cases. And I believe it's going to continue to go up. And just this morning, I saw 509 new cases, and it's continuing to rise. Personally, working in the ED, I'm seeing many new cases and many suspected new cases, and I'm having to develop plans for if I have to quarantine my docs, if they get exposed or test positive themselves. So I'm looking at having to take part of my physician team offline, and that's concerning to me as well, because I'll have to be seeing an increased patient population with a decreasing team of providers to see them. So that's obviously a concern. In terms of ED impact of this, there have been studies, one in the Lancet, and there have been other studies showing that universal mask wearing will decrease the spread or help decrease the spread of COVID. It'll also help improve, as Dr. Steinschauer had mentioned, the economic impact and help improve the GDP. And so thereby increase economic freedom, because I know one of the kind of opposition points is that this is a freedom limiting thing, but wearing masks is actually a freedom increasing thing rather than a freedom limiting issue. So I want to add my voice to the voices that you've already heard, basically recommending that we mandate rather than merely recommend mask wearing. We have a history of mandating via laws public safety measures. We mandate seatbelt wearing in cars. We mandate child safety seats in cars because we know that these are public safety measures that work and save lives. This is no different. And so I want to strongly recommend to this council and yourself, Your Honor, that we mandate that people wear masks in public during this time of great danger. Thank you.
So, Doctor, just a follow-up question. You mentioned you personally saw a bump on Mother's Day and Memorial Day. We had this meeting held right before 4th of July in fear that another public gathering might increase a bump. In your medical opinion, is it important that this legislation gets passed before another holiday, or in your medical opinion, could we wait longer?
Absolutely, and that's why I'm so glad that you're having this meeting today, because I think the bump that we're seeing now is from the previous holidays. And so, yes, I think it's critical that we do this now rather than wait. So and thank you for asking that question, Your Honor.
So just clarification, Tuesday would be too late in your medical opinion?
I personally believe so, yes, in my medical opinion.
And I can confirm in your testimony that masks are effective in your medical opinion?
I've read several studies. The most recent one I read was in the Lancet, so yes.
Are there any questions for the conferee? Seeing none, we thank you, Doctor. The chair will now recognize Dr. Steve Davis, Family Practice Primary Care Doctor. Dr. Davis, the floor is yours. Mr. Davis, I'm afraid you might be muted.
I received this is Dr. Moore, just received a message from Dr. Davis who said he didn't get the link. I'll send it to him. It might be a bit before he joins.
So we will retain the floor for, or we will retain a position of Dr. Steve Davis next on the list until then we'll have Dr. Sherry Breed, Family Practice and Primary Care, give her presentation, and then we'll go back to Dr. Davis. Dr. Breed.
Hello, thank you, council members, for receiving us today and for holding this meeting on such a day that you should be at home with your families. So we really do appreciate it. So my name is Cheryl Beard, and I'm a family physician here in town. I work for Ascension Medical Group. And so I am a primary care physician. So I see patients of all ages, from very young to very old. And I would say to echo Dr. Ott's points that it's been the most recent up-to-date evidence in the Lancet does show that masking does reduce the spread of the coronavirus. And so instituting mandatory masking will help reduce the spread and help keep the curve flattened so that we can go on and continue to have our kids go to school, as Dr. Reddy was saying, and continue to have our parents be able to go to work and not be ill. So you'll have to pardon my reference, but I do liken the spread of coronavirus and masking to having sex and condoms. So everyone wants to sort of share each other's air, and in order to protect ourselves, we need to wear masks in order to share each other's air. So if you think of it in that context, I think a lot of times that might help ease people's minds of like, wow, I'm becoming infected by being too close to someone. So if we want to continue to go to the hairdresser and have football games this fall and have our kids in schools, I think it's very important that we have mandatory masking. So I appreciate your time today. Thanks.
So, Dr. Beard, just can you, because you have some time left, could you just briefly tell us how COVID is spread and how masking stops that?
So thank you for asking the question. So coronavirus, COVID is the illness, coronavirus is the virus. It's spread by respiratory droplets, which means that when I speak, talk, yell, sing, my droplets come out of my mouth and I spread them up to 6 to 10 feet, depending on what I'm doing. If I'm yelling at a football game, it certainly comes much farther than that. So it's spread by those droplets, and other people breathe in those droplets. And then that's how they get the virus. It spreads on hands, touching nose, mouth, hands. It's spread in that instance too. So frequent hand washing, masking, and remaining distant from others, socially distanced, those can all prevent the spread through these droplets.
Thank you. And just for the record, you would recommend a mandate for masking as the governor has issued, or do you believe that a recommendation for people to mask would suffice?
So recommendations for masking doesn't seem to work. And so I would currently encourage the council to enforce mandatory masking. Thank you.
Thank you, Doctor. Is Dr. Davis back online? If not, we will reserve his, I have a council member who would like to ask a question of the conferee. So Dr. Beard, if you would stand by, Chair recognizes Councilmember Fry.
Dr. Beard, are you still on?
Yes.
Didn't understand your point on condoms. What was your point there?
So my point is that people a lot of times, not me personally, but people a lot of times want to be able to have sex freely, and the way they do that is by wearing condoms and try and prevent spread of disease or contracting disease by wearing a condom. So masking is similar in the sense that if you and I want to be close to each other and share the same air, that if we both have masks on, we can protect each other.
Right, but there's no mandate to wear a condom, correct?
Correct.
Okay.
Correct. No mandate to wear a condom.
So just on that same line of thought, people aren't getting pregnant by airborne droplets currently, is that correct? Okay, so if they were, then maybe we might be mandating a cloth mask if it was making people pregnant, is that correct? So,
yes.
Just wanted to make sure we hammer home on the same logic here. Your reference was to express that a barrier that prevents a fluid from coming in contact with someone else, use that connection with a condom to mask to make that point. Is that correct?
Yeah. Yes, that's correct.
Thank you. Any other questions? See none. Dr. Davis, are you back on?
I am. Can you all hear me?
Yes, sir. The floor is yours.
Okay, thank you very much. I appreciate the opportunity to speak. My name is Dr. Steve Davis. I'm a family practice doctor in the community, and I've been following this on YouTube. I'm sorry I didn't get the link initially, so we just had some technical difficulties, so I'll throw in now. I'd prefer not to repeat things that other physicians have already said. So I've actually been following some of the comments on the YouTube side of things, and so I thought I might address a few things just for clarity, if that's okay. One thing I'm seeing a lot of information about that people are just really seeming to focus on is how effective masks might be in blocking the transmission. That seems to be something people are relatively obsessed with. And Dr. Beard just referred to the point that our job here is essentially what's called source control among infectious disease, and Dr. Moore can talk about that a little bit more later probably. But source control is an effective old school technique that keeps people from spreading things like tuberculosis and other respiratory pathogens. So this has been around for a long time. It's a tried and true old school low tech type of intervention. And in this case, I see a lot of people bouncing things around about particle size and that kind of stuff. And there's really a wealth of information in the CDC about this. But essentially, the reason we use the 0.3 micron particle size is, and NIOSH covers this as well, is that particles that are smaller than that can get through the fibers of a mask, even an N95, but they lack the mass to actually effectively penetrate. Particles that are larger than the 0.3 micron particle size are generally caught within the fibers and the network. So that's why this is kind of the gold standard size when they're talking about N95 masks. Surgical masks, are thought to block between about 60 and 80% of even airborne particles. And then cloth masks will block some airborne particles. So when you're talking about protection that way, it's important to understand, that feature of the science of it. Now, then you get into respiratory droplets versus airborne particles. And respiratory droplets, as Dr. Beard was talking about, generally travel, up to about 6 feet. What I tell my patients in the office is that it's like a projectile from anything, if you look at physics. So whether you're talking about an arrow, a bullet, anything, when it leaves the source, it immediately starts to fall due to gravity and other forces. Respiratory droplets tend to go about 6 feet before they land on something and stop moving, okay? And this virus is spread, we think, maybe not exclusively, but almost exclusively by respiratory droplets. So if you're wearing a mask, you actually stop respiratory droplets effectively from coming out of that person in the first place, and you stop transmission. Airborne particles, one of the reasons we don't want people sitting in rooms close together is because those airborne particles go into aerosol, is basically the best way to think of it. So they're floating around in the room and people can breathe those. And that's why healthcare professionals wear N95s in many circumstances, because they're trying to filter out those particles that become suspended in the air. And after we are exposed to multiple patient after patient after patient after patient, we're breathing that air that might be accumulating viral particles. So that's the difference there. So I just wanted to shed some light on that. But really, this is not a controversial issue. This is actually very simple stuff. And I've also seen a lot of comments about people saying, I don't really know anybody that's had one, which is not a very effective, the disease, which is not a really particularly effective argument. We know the disease is out there, and we know that it spreads like it's doing, like wildfire when left unchecked. Eventually, everyone will know someone who's had it, and everyone will know someone who's had a complication or died of it if we wait. So, and we don't want to wait through mass gatherings like 4th of July weekend. So that would conclude.
So with that, if you would stand for a question and let the chair indulge. Is the medical science, or at least the legitimate sources that I believe you and your colleagues will look towards, are they in support of cloth masks at this point for prevention of the spread?
Yes, because of what I was saying, because they're effective source control. So if everyone wears a cloth mask, you essentially stop respiratory droplets from moving, and respiratory droplets are how it's transmitted.
We understand that the CDC and a Mayo Clinic are both in favor of cloth masks to be utilized to prevent the spread. Is there any equivalent medical journals or sources that are against, as far as status, equivalent as far as status, that are against wearing masks or that think it's ineffective. So it's simply,
I think that's
is what?
an outstanding question to be asking when we're going to try to balance the science. I'm really glad you asked that. And the answer is no.
So it's reasonable to believe that the academic community and the medical community are in line with the idea that cloth masks are an effective way to prevent the spread of COVID. It's an accurate statement.
That's an accurate statement.
Is there anything else you'd like to add? Or is there anyone who would like to offer questions to Dr. Steve Davis? And just for the record, doctor, you are a family practice / primary care.
That is correct. Thank you for your time.
Thank you, doctor. We appreciate it. If there's no questions, we will move on to the next conferee. Chair recognizes Dr. Bassem Chihab, and I apologize, who works in cardiology. I apologize ahead of time for the name. I'm terrible at this. Doctor, are you there?
He was on call today, so I'm not 100% he actually made it on.
We will, if he comes back on, we will recognize him. So with that, we will move down to Dr. James Walker, anesthesiologist. Dr. Walker.
Also another one who was on call, so I am not sure if he is on.
We retain the person on the list. With that, the chair recognizes Dr. Patricia Watt-Harris, OBGYN.
Yes, I'm here.
The floor is yours, doctor, and we appreciate you being here.
Okay, thank you. I am Dr. Patricia Wyatt-Harris, and I've been in private practice in OBGYN for 34 years here in Wichita. I'm also the president of the Sedgwick County Medical Society. And so I wanted to make the statement that this has come up so quickly that we didn't really have time to have an official board vote on a mandate from the Medical Society. But physicians in this community and public health officials are all overwhelmingly supportive of a mandatory mask rule to help keep our economy open and our citizens safe. I think that's really the simple way to talk about it. If we don't do this, we're going to be back in a situation where we have to shut things down. The schools are very important. We do want people to be able to go back to school in the fall. And with the current trend, I'm afraid we're going to have to go back to the shutdown that we were in before. As a OBGYN physician, I also have overwhelming support from the OBGYN physicians for mask mandate in Wichita. One thing I wanted to emphasize is a lot of people are saying, well, I don't have it. I don't know anybody who has it. So why do I have to wear a mask? The most important time to protect people is during the asymptomatic time when they can spread the virus. A lot of people aren't going out when they're sick because they don't feel like it. But when they are out and about and keeping our businesses open and going to the grocery store and doing all the things we need to do, it's the time when they're asymptomatic that they're going to be most likely to spread this. And we are protecting people from us spreading it to them by wearing a mask. So I just think that's a point that we need to really take and think about. And with that, I'll yield.
Doctor, you said you are the current president of the Sedgwick County Medical Society, is that correct?
That's right.
Were you elected by your colleagues to this position?
Yes, I was.
So it's reasonable to believe that you represent their best interests, or they have a tremendous amount of respect for you. Is that a fair statement?
Yeah, I think so.
Not to make you blush.
You can ask them.
And it's your personal opinion as a OBGYN and the president of the Sedgwick County Medical Society that a mask mandate would help eliminate the spread or limit the spread of COVID?
Yes, that is my position.
And although that the society hasn't had a chance to take a vote on this matter, your opinion is that, at this point from your testimony, your opinion is that your colleagues share, or a higher percentage of your colleagues actually share that opinion as well, that masks should be mandated to limit the spread.
Yes, I think they all, I guess I can't say all, but I actually have not heard any dissent in the medical society. I've only heard support for a mask mandate.
So though there's been no vote, your role as president, when you interact with the doctors who make up the Sedgwick County Medical Society, you have yet to hear anyone dissent against a mandatory mask ordinance or
That's right.
medical prevention. Any questions for the doctor? See none. Thank you, doctor. The chair now recognizes Dr. Paven Reddy, oncology. Dr. Reddy, are you with us? I heard something. Dr. Reddy, are you on mute? Or if not, if there's technical problems, I can go to the next person. But Dr. Reddy, are you with us at this time?
Dr. Reddy had to leave the call.
Excellent, thank you for that. We will retain his spot on the list. Chair recognizes Dr. Tom Moore, infectious diseases.
Sorry, I hit the unmute button. I apologize in advance. I'm on call as well, and there may be some noise in the background since I'm not in a quiet room. But thanks again for Mayor and council members for calling this, convening this very important meeting. My views. I'm an infectious disease physician. Just a quick. I've been in this community since 1997. I'm a lifelong Wichitan. I trained at the NIH with Dr. Fauci, and I've been in town since 1997, with the exception of 2 years where I was chairman of infectious disease at Ochsner Medical Center in New Orleans. Long story short, my position on this has been made public and very clear, and I don't really have a lot to add to what my colleagues who've spoken before me have said. I would say this: that one of the problems we've experienced is that there's been a mixed message in the past. When this whole problem started, there was a shortage of masks, and we didn't want everybody to have a mask because we wanted to save them for healthcare workers. Not to mention the fact that there were some data that suggested that masks actually increased the risk of infection because people were constantly touching their faces. Since then, we've learned so much about this virus and its transmission that the message has changed significantly. And now I can say with absolute confidence that the science is very clear that masks save lives. And I'm talking about everybody using a mask. If you look at the data from Japan, Singapore, Macau, and Hong Kong, where you have 80% of, at least 80% of the population wearing a mask, and that's, by the way, when I say mask, I don't mean just N95 or surgical mask, I mean a cloth mask, then you have a significant reduction in the transmission of the virus. So much so that they're essentially able to go about their business and don't shut down their economy at all. Is it possible? One concern I have, we all have, is that we don't know if it's now too late. As with the case with Arizona and Houston, they are acting at a point where Houston has run out of ICU beds. They've expanded their capacity and they expect to run out of all hospital beds in the next week. And they're just now starting to talk about mandatory masks. That's too late. I don't know if a mandatory mask order with the city will prevent the deluge of cases that we may see. But I can tell you that without a mandatory mask order, we definitely will see a tsunami of cases that threaten to overwhelm us. And will definitely cost lives. This is I can't emphasize this enough. This is a public health emergency, and the problem is that it's more pervasive than we have public health initiatives to mandate seatbelts and kids in car seats, all of which have been proven to save lives. But this is more pervasive because this is an invisible threat that no one can see when it's being transmitted. And more to the point, not everybody has a kid who needs a car seat. But I guarantee you, everybody's got has health that needs to be protected. I think I can say, Steve mentioned something about source control, and the genesis of that is the is John Snow and the Broad Street Pump in London, England. Not to go on too much, but I'll say this. There was a cholera outbreak that was sweeping through the city of London and killing scores of people. John Snow, who's an early epidemiologist, was able to identify the source as this pump that was coming out of the Thames River. He took the handle off of the pump. Indeed, he had to do it under armed guard because people were threatening violence to him. But in so doing, in showing the leadership of that moment, he was able to take, with the Queen's order, he was able to take the pump off the Broad Street pump, or the handle off the Broad Street pump, and he stopped the cholera outbreak. In fact, to this day, you can still see the Broad Street pump. It's been enshrined as a national landmark. This is very similar to that in that we really need, this is a point at which we need to act in order to stop the transmission of this virus, or at least blunt the transmission of the virus and prevent it from taking more lives. So in closing, I'll just say that the simple message is that masks save lives.
So, insofar, all the medical testimony has been in support of a mask mandate. However, part of your testimony was a little different, where you referred to the ICU beds in Houston. And just for the council and also for those who might be watching, could you tell us what happens if all the ICU beds were to be used up here in Wichita, as has been predicted if we take no action?
Well, I'll tell you what's happening
like?
in Arizona, for example, is that they have reached their maximum capacity. They're having to ship patients to other states, specifically California, to be taken care of. And California is undergoing is experiencing their own problem with this virus. They're literally having to make decisions about who lives and who dies. And more to the point, if you have people with reversible diseases, say diabetic ketoacidosis, or somebody who has a heart attack or a stroke, these are diseases which are treatable, or patients with other infections where the diseases are completely curable. Those patients may succumb to those otherwise treatable and curable illnesses if they can't get access to medical care. And that's one of the problems that they're facing in Houston. It's so dire that Texas Children's Hospital, which is exclusively a pediatric hospital, has opened up their hospital to adults in order to accommodate the crush of patients.
So that would be what I believe has been referred to as preventable deaths. Is that not just people dying because they catch COVID, but people who might have chest pain, show up at the hospital, can't get admitted, they go home and they wind up having a heart attack. Is that an accurate layman's interpretation of the point?
That's exactly correct, Mayor. The main problem we have, the concern that we had when this all started, was that we didn't want to have the healthcare system overwhelmed, so that we could take care of people with treatable and curable diseases. We're at a point now where our numbers are such that it's looking like we may get to that point. And this, the lockdown helped, certainly. And I want to emphasize that wearing a mask is but one of the three key ways to prevent getting the virus. That hand hygiene and social distancing are important, but the one thing that of those three that is by far the most important is wearing a mask. And we can recommend putting kids in car seats. We can recommend that you don't drink and drive, but people still do it, and they cause trouble. If we can mandate it, people would be much less likely to do those to spread the virus.
And just final question, then I'll go into the next conferee. Actually, the next conferee is a hospitalist. I will reserve my question for the next conferee. Any questions for this conferee? See none. We thank you, doctor, for being with us. With that, the chair will recognize Dr. Wes Kirk, Hospital Medicine. Dr. Kirk, you with us?
Yes, hello.
Welcome.
Thanks for having us to be able to share our perspective from these different fields. I'd certainly echo everything that's been said by my colleagues. My perspective, I'm an internal medicine hospitalist here at Wesley Medical Center. I help as co-director of our group and was with our crisis care committee with COVID response here since the inception, and I've been involved with Dr. Steinschauer and Dr. Ott and Dr. Moore in the inpatient care of a lot of these patients here at Wesley. And so I don't have anything more really to add as far as the science of masks, and I think the things we're seeing in other states where they're now having to back off and now do mandates or close down parts of the economy that had previously been opened. I think that's kind of our warning signal of now is the time before we get to that point if we haven't already missed it. A lot of the things I've heard from friends out in the community is that they don't have symptoms or that they don't know anybody that's been infected, and so they feel like the risk is low. We are starting to see more of those patients, though, who've come in for other things, who for one reason or another are getting tested for coronavirus and come out positive, and they were unaware. I actually have a patient today that has no idea where he could have gotten it from. He's only been to the grocery store, and an unsolicited question from me, he says, "Why won't people wear their masks? I don't understand." And so that's frustrating to see in these vulnerable population who are doing everything right to still get this virus. And so for me, it kind of comes down to just the ask. We're asking a simple measure that all of us can do. I think we all in this country think our ideals are that we care about each other. And I feel like that's something we can do very easily for our neighbor to show that care and concern for those around us who maybe are more likely to suffer consequences. And so I think the ask of wearing a mask is much less than the potential, if things were to get out of control, again, of having to back off on the opening of the economy. I think that's a much bigger ordeal and will cause much more harm, obviously, to economy, individuals, than simply wearing a mask would be. Our recommendations for mask wearing were there. The campaign to keep Wichita open was there. And I don't think it's been met with great response. And so I think, as all of my colleagues have said, I think a mandate at this point would be warranted to help emphasize the dire need that we're in. That's all I have.
And Doctor, just as a hospitalist, could you talk a little bit about how Wichita is a regional hospital and not just a city hospital, and how those numbers affect what the last doctor referred to as running out of ICU beds? Are we at a larger threat being more than just the city, but also region?
Yes, absolutely. You know, we're a referral here at Wesley. We take care of even the western 2/3 of the state and some of southeast Kansas as well, funnel here for more complicated cases and other specialty needs. And so certainly as the volume increases for other medical issues, if we are becoming more overrun with patients with COVID, that certainly limits our capacity to be a referral center for those smaller communities, the critical care or critical access hospitals that rely on us when they have to escalate the needs that patients have. And so that is a concern, certainly. We want to be available not only for those who have COVID, but those who have all their other medical issues, which unfortunately was an unintended consequence, I believe, of some of the lockdown and everything that happened. People were not seeking medical care at the time that they needed it. And there were many complications, preventable deaths, as you alluded to, during that time. So we want to be able to be available for that, and feel that if we are able to limit the numbers in any way, I think that's something we all as a community should be all on board with trying to do. So.
Any questions for the conferee? We see none. We thank you, Doctor.
Thank you.
The chair now recognizes Kimberly Kasitz. She's a registered nurse with USD 259, Director of Health Services. Welcome.
Good afternoon. I'm Kimber Kasitz, the Director of Health Services for Wichita Public Schools. I've been a registered nurse for 26 years. I also serve as the president of the Kansas School Nurses Organization and am a member of the National School Nurse Organization, which is having our national virtual conference this week. And one of the main topics is how we're going to return to school in the fall safely for staff and for students. Our foremost concern and our top priority is health and safety. We're advocates for children and our community, as well as the adults and the staff in our schools. And NASN has a position statement on interim guidance for the return to school and the role of the school nurse. And they cite the CDC guidelines and recommend masking for staff and for students that can wear masks. A lot of school districts are currently working with KSDE, including Wichita Public Schools. And we're looking at the recommendations from the Kansas COVID work group for kids, which I'm also a part of that Dr. Reddy mentioned earlier, It's healthcare providers from all across the state giving evidence-based recommendations to school districts on the return to school and recommending masks for students age 12 and up, and for all staff in the schools and visitors and vendors and volunteers. So Wichita Public Schools has already implemented mandatory mask wearing for staff members. And, we're seeing that people are doing that. They want to be safe. We conducted a survey of our staff and our families, and the number one concern with returning to school was what? Safety for themselves, for their children. So to me, I feel that I strongly ask you to mandate mask wearing in public places. We really need to stop this curve. Our kids need to get back to school, not only just to learn, but for their social, emotional health, for their well-being, to have access to food and to care. We have 50,000 students and nearly 9,000 staff members with Wichita Public Schools, and we are working tirelessly to develop plans so that our staff and kids can return to school, so that their families can return to work, and we can all be safe and healthy and flatten the curve. Thank you.
So, ma'am, if you would indulge a question, and it's not so much for medical advice, but your experience as a registered nurse in our USC 259, we all know that there would be a devastating economic impact if schools don't go back into session. We've already heard from a medical expert about the social and psychological impact if schools don't go back into session. Can you just tell us, given the population of USC 259 is very large, is it reasonable to assume that access to a registered nurse in school for many children is probably some of their most primary medical care? Is that a fair assumption? And if so, could you expand on that?
That's an excellent question. I'm very glad that you asked that, because we're like that link for a lot of these families and kids. And we do have students that their parents trust us as registered nurses in the school setting, and that access of having someone with the knowledge to help them manage chronic healthcare conditions, seizures, diabetes, asthma, mental health conditions, medication and treatment management. However, we try to break that cycle of just utilizing the school nurse only, but we're usually the first people to recognize that something's going on. There's a pattern of behavior, psychosomatic visits to the health room. The management of their diabetic care is not being handled well within the school. So we're that link to our community healthcare providers, our pediatricians, our clinics, and our specialists. We have so many students with specialized healthcare needs, mental health needs, and chronic health conditions. And so it is important that we have a school nurse, registered school nurse in the schools across Kansas, or someone that is going to manage healthcare for the students, preferably a nurse. But the answer to your question is yes, a lot of families and students really utilize that connection of having a healthcare provider within the school setting.
So just to summarize or synthesize some of the information for the medical professionals who have taken time to be on this call, the trajectory, if we do nothing now, will put us towards another shutdown because we're at the same rate as some other states with the modeling. We'll have a psychological and academic and social impact if school's not in session. You are now confirming it will also have a negative medical impact on some of our more vulnerable students where they depend on school nurses to be that link. Is that an accurate summary?
Absolutely.
Questions for the conferee? Thank you. The chair now recognizes Dr. Joe Nold, who is a surgeon. Dr. Nold, the floor is yours.
Thanks for letting us speak today. Once again, I don't want to cover a lot of the topics that have already been covered, but I'm a general surgeon, trauma surgeon, critical care specialist, and also the president of the medical staff at Via Christi St. Francis, and the medical director of the surgical ICU. So as a surgeon, I wear a mask the majority of my day, and wearing it out in public is a nuisance sometimes, but it is the safest thing that we can do. Just to touch on a couple subjects that haven't been touched on. As a surgeon, our patients that come in that are asymptomatic COVID carriers are at a tremendously higher risk for complications with even routine surgeries. So whatever we can do to slow down the spread of the coronavirus before patients get to us helps us out and helps the patients out tremendously. It's difficult sometimes to convince people to do this, and we don't like to mandate things, but this is just the safest thing to do. As an intensive care unit physician, I'm also part of the team that is in charge of scarce resources when we become overwhelmed. So there's a team of people that take call and are involved in this, and we're the ones that have to decide who gets a ventilator and who doesn't. If we run out of ventilators, who gets an ICU bed and who doesn't. And this just doesn't affect patients that have the coronavirus. If you're in the hospital and we run out of ventilators, if you've had a heart attack, you've had a stroke, you've had bypass surgery, you've had any number of surgeries and you're sick, you go into the same pot of patients that are fighting for a ventilator. And that's a very difficult decision that hopefully we don't have to make. We may have to make that decision if we don't slow down the growth of our spread. And we don't like to mix medicine and politics, but I'll chime in on this, that I'm a lifelong libertarian, and I don't like to be told what to do. But using the free hand of the free market, counting on that to guide people's choices and to let things work out, that counts on people making rational decisions in their best self-interest. And the best way we can do that is to wear a mask, even for a purely selfish reason, to protect yourself. Let alone protecting others is just an added bonus to that. So whatever we can do to trust the expertise of all the healthcare providers that are on here. We've got great primary care doctors and ER doctors and anesthesiologists. But on this panel, you have Dr. Steinschauer and Dr. Moore that are two of the experts in pulmonary disease and infectious disease. And if there's anybody you're going to listen to these two. You can ignore what I say, but listen to what they say. And it's a simple, easy thing to do. And this gets us back. If we can do the simple things, we can avoid draconian measures where the government has to shut down businesses. This gets us back to normal, back to business as usual. It gets our kids back in school faster. Let's do the easy thing of wearing a mask, and then we don't have to lock down. We don't have to shut down the economy again, which could be devastating. So I appreciate the time, and thanks for hearing us, and be well.
So, Doctor, in the beginning of our pandemic, when we were under lockdown, I was on a almost daily call with medical experts and with policymakers, and my understanding is that at our height, we had about 200 ventilators in Wichita. You mentioned ventilators. Would you say that was accurate or right around that number? If we had a guess, how many educational guess, how many ventilators we might have right now?
And we've got enough for what we need right now, but as busy tertiary care hospitals, we run at high capacity on a normal day without a pandemic. So if you add in an unexpected 10 or 15 patients on a ventilator, we might be out. And if you're having to decide who gets a ventilator or who gets a new ventilator, who gets an old ventilator, who gets one that's been repurposed, having patients bring in BiPAP machines from home to try to use, and if they get to keep theirs, if they get sick, there's just not enough equipment to take care of the number of patients that would come in, even if we could build it as fast as we could. That there's just not enough space in the hospital. There's not enough people to run the ventilators. There's not enough people to take care of these patients. So whatever we can do to slow down the growth and keep people out of the hospital and keep people well protects not just patients with the coronavirus, but protects every other patient in the hospital, because they all get same boat. They're all taken care of by the same staff. And they're all fighting for the same resources if we do get down to a shortage.
So it seems like there is a limited number, and I know a number fluctuates. 200 was what I recall, and it strikes me when in the last 24 hours we had 170 cases of new coronavirus. So it is, if we're not going to put a number on it, which I understand on the call, they were very resistant on putting a number on it because some of these ventilators get loaned out to hospitals as well, so we might have less. At the very least, though, we can agree that there is a limited supply of ventilators and we don't have enough.
We're using the majority of our ventilators on a normal day to take care of our normally sick patients and our normal surgery patients. COVID patients that come in are just an added drain on the system. They're an already short supply of medical equipment.
Of course. Just a different question, if you would indulge. Some people are comparing this to the flu. These experts on my Facebook wall are telling me that this is just the flu. Could you address that? Is COVID equivalent to the flu?
It's spread in a similar fashion, but the flu's not deadly like COVID is. The flu isn't asymptomatic for a long time when you're spreading it. And if there's anything that people can do is ignore the pseudo Facebook experts on medical care. You have tremendous amounts of brain power here in this city and on this call. Trust them. Trust the people that have dedicated their lives to taking care of other people. You've heard how many people here are on call. I bet half of the people on here are working today. We've sacrificed everything to take care of patients and take care of families. There's not a big conspiracy to make people do anything that's not in their best interest. So it's not like the flu, but just get your advice from dedicated, intelligent healthcare professionals.
Amen. Is there any questions for Dr. Nold? Chair recognizes Councilmember Fry.
Thank you. Dr. Noel, quickly, how many U.S. deaths from the flu have occurred in 2020 so far this year?
I'd have to look that up. I bet Dr. Tom Moore could probably give us a fairly close number off the top of his head.
I'm looking at a CDC website that says 24 to 62,000 estimated so far this year. So it is deadly, right?
Oh, absolutely.
Okay. Thank you. Just want to be clear.
So let's go ahead and go up to Dr. Moore. There's no further questions for the conferee. So 24 to 64,000 deaths this year from the flu. How many deaths have we had with COVID?
Well, nationally, it's over 120,000. And by the way, those deaths occurred within a span of a few weeks. You know, the influenza season goes from basically December to April. So you've got a population about the same size as the city of Newton dying every year, dying every flu season. This is 4 times that, and occurring in a span of 8 to 12 weeks. And by the way, it's only getting worse. That's when the virus arrived. That was in the early part of this outbreak. As Dr. Fauci has said, that if this problem is going the wrong way, and we may be looking at periods where we're seeing 100,000 people diagnosed with this infection on a daily basis. We have to do something. And I want to say, echo what Dr. Nold said. If we rely, most of the people want to do the right thing. And the problem is, like patients those who have active pulmonary tuberculosis who cough and spread it, it's really a minority of patients with tuberculosis, but those are the ones that we need to rein in because they're highly infectious. With this virus, we don't know who is infectious. We know a lot of people probably are, and because it's impossible to know who has it before they show up with symptoms, and we also don't know who they are in 80% of those who have the virus who have no symptoms. It's absolutely critical to make sure everybody wears a mask. But we rely on people's good behavior and good faith, but that doesn't work with public health initiatives.
So just a follow-up and then a new question. So on the line of a flu, this virus has not has not impacted the population to the same level as the flu. Is that an accurate statement? Which means we all are
Say that again.
exposed. This virus has not impacted spread and been in our community as much as a flu virus. Is that an accurate statement?
Well, I don't know the answer to that because as you heard from the public health department, they're only able to test. They're so short-staffed. They're only that is through Lacey Cruz. They're only able to test those who are symptomatic. We don't know how many people are out there who are asymptomatic who simply cannot get tested because there's not enough staff to do it. I think it's fair to say that patients who have the number of people who have asymptomatic influenza is quite low. The vast majority of people are symptomatic when they have it. That is not the case with this virus. Approximately 20% of people who get infected develop symptoms. You're really looking at the tip of the iceberg. What Dr. Steinschauer pointed out was that we have the 8%, a little more than 8% of the people that we're testing are positive. That's exceptionally high and a significant jump from the people from the 2% we had just 2 weeks ago. So to answer your question, Mayor, I don't mean to avoid it. What I'm trying to clarify is that, trying to point out is that there's some information we don't have, but that is, I cannot give you exact numbers, but what I can tell you is that this virus for sure is going to spread through this community way faster than the flu if we do nothing.
And in your opinion, it'd be more deadly?
Absolutely. That's been proven already.
Just a follow-up question. As we learn more about this virus, this is a brand new virus. It's a new virus or strain that's now within the human population, and we're learning more about it. My understanding is that we're finding that even those who might have gotten beyond COVID are now having blood clotting. There's other follow-up conditions that we're still learning about. Could you speak to that a little bit?
Yes, just a couple of things. First of all, the greater number of people that are infected with this virus, the more the virus will mutate. To date, there have been described some loss of function mutations where in the lab it seems maybe it's less deadly. In other situations, it's actually become more deadly. In fact, the currently major circulating strain is this European strain, which has mutated and gained function where it is much more infectious than it was when it came out of China and arrived in Europe. So there's that. The biggest problem we're having with this virus is not just the fact that people can become very sick with it, but the side effects of it. We have people that have ostensibly recovered from this virus who then die of blood clots. And these are, by the way, these are people who have been on blood thinners, despite these blood thinners having therapeutic levels of blood thinners in their body. That they've sustained devastating strokes, heart attacks, and clots to the lung, which have essentially snatched defeat from the jaws of victory. We thought the patient was better, and then they died. And Dr. Steinschauer can speak a little bit about this as well. But we have certainly seen patients who, because this virus seems to infect the cells that line the blood vessels, patients are more likely to develop clots. And what happens is that they develop these small clots in their lungs, so that if you are fortunate enough to survive this viral infection, you get to go home, but you may be on oxygen the rest of your life. Or you might you might have limited function so that you cannot actually do the job that you normally would, and you go on disability. There are some devastating stories, anecdotes, to be fair, which we can certainly share with you, but as a statistic, there are data which are very clear that show that this virus does not just damage to the lungs in the acute setting, but subsequent to that, patients develop devastating clots.
So unlike something like the flu or cold, once it's gone, it's manifesting itself into other health conditions.
That's right.
Thank you.
Your Honor,
Yes.
may I add to that?
Please do. The floor is yours, Doctor.
So 62,000 deaths from the flu may sound like a whole lot, and it kind of does. But you have to remember that that's from an estimated, this is from the CDC website as well, from an estimated 56 million cases of the flu. So when you do the math on that, that equates out to a death rate of roughly 0.1%. So 1 death per 1,000 people. The estimated death rate for COVID is roughly 3 to 4%, which is probably 300 times higher than that. That's way, way more. So you're talking a lot more deaths with a lot less infections.
Thank you, Doctor. Has, just run through this real quick, has Dr. Basim returned to the call? Basim Chihad. Has Dr. Pavan Reddy returned to the call? Has Dr. James Walker returned to the call? I believe those were the 3 who we skipped over because they are on call and had to go help, I believe. So I wanted to roll call them to see if they return so that they could add their input. With that, would the medical professionals please stand by for possible questions? Chair recognizes Councilmember Claycomb.
Thank you. I don't have any questions. I just want to thank all the doctors and healthcare providers today. I really appreciate you sharing your expertise and experience with us, so thank you.
Other comments or questions? Chair recognizes Councilmember Clendenin.
Thank you, Mayor. I also want to thank all of our health professionals for being here today, for taking time out on your busy holiday weekend. A lot of people were really looking forward to getting out of town, and it's commendable that you'd be here caring for your community in a way to do that. So thank you. My issue really isn't with any of the facts that our medical community has made today. I don't want to dispute anything they've said. I don't have a doctorate, so I won't do that. But it is my job to take a look at the law and see what we can and can't do and what our purview is. And KSA 65-119 gives the Joint Board of Health the authority to handle issues of infectious or contagious diseases. The state does not give us authority to make an ordinance. That would even include through home rule to govern the handling of infectious or contagious diseases. It gives it to the Board of Health. And so we have to be very careful about overstepping our bounds here. I know that we care. I think a lot of people are scared. I wear a mask. I think everybody in here wears masks. But making this decision because we're scared and because it's something that we feel like we need to do does not give us the authority to do it. And so we also had House Bill actually 2016, I believe, that gave extra authority for the county commission to do what they did today. Not today, yesterday. Whether we agree with it or not, they have the authority to do that. And according to KSA 6519, we aren't the Board of Health. We do not have that authority to act as the Board of Health and to act in a way that would make a decision based on infectious or contagious diseases. So this really does lie with the county commission. I know that our Attorney General has been reached out to. I don't know if he's going to give an opinion. He did give an opinion on HB 2016. I have it here if we need to read his opinion about HB 2016, but it's very clear that counties have that sole authority. So I just need to put that out there. We have quite a can of worms that we're going to open if we were to pass an ordinance that was unlawful.
Councilmember, you going to do a follow-up question You mentioned that you don't have a doctorate. Does that include a Juris Doctorate, which is required to practice law?
Well, I will tell you this much. The citizens elected me to be able to read the law and look at the law and interpret the law, and I have to vote on ordinances that we put into law, so I think it really shouldn't matter whether I have a law degree. Whether or not, if I'm voting on laws, I have to be able to know whether or not we have the authority to do that.
So your legal opinion might be better put towards our legal staff, our director of the legal department, who does have a law degree. Jennifer, would you please address the legal concerns of our council member? Do we have the authority to pass an ordinance such as this?
Mayor, council members, Jennifer Magana, city attorney. As the agenda report specifies, this is operating under the city's home rule authority, which derives from the Kansas Constitution. This is separate and apart from any statutory scheme. The counties and the state have special powers under statute for emergency operations. There is a Chapter 65 that talks about counties' authorities as a board of health or various boards of health. It's my opinion that this is different and apart from that. It is not clear to me that Chapter 65 specifically, intentionally, and clearly preempts local authority to act under home rule. There's a framework to look at whether state law has preempted the field. There have to be a clear intent to preempt. It has to actually present a conflict from what you're trying to do at a local level from what the state law says. So I believe under the city's home rule authority, which is to regulate matters of local concern, like health, safety, welfare, that this ordinance operates under that authority, and like any other ordinance, can be challenged. We don't have a case in Kansas that has interpreted an ordinance just like this. So the basis, though, for this ordinance, in my opinion, is the local home rule under the Kansas Constitution.
Has the Attorney General reached out to you and told you that we can't proceed with this?
No.
So in your learned legal opinion, there is no legal interpretation under Kansas statute that would prevent us from moving forward with this health ordinance?
Well, as I said, there's no Kansas published case that would address this particular ordinance. I can look at other things in interpreting the home rule authority we have, and I believe in similar cases, based on these facts, as best as I can tell, home rule would be an appropriate source of authority for this ordinance.
I just wanted to make sure that we were in our legal authority so we could suppress any concerns that we would be outside of our jurisdiction. Chair recognizes Councilmember Johnson.
Thank you, Mayor. I had a few questions and comments, but I'll wait till after we get to the public piece. But I wanted to thank our medical professionals for taking the time today, as my colleagues have, to be here and provide your expertise and some powerful information that addressed a lot of the social media experts that I hear from as well. So I appreciate that, and this is something that I will continue to share for them to hear your thoughts and perspectives. So thank you.
Councilmember Claycomb.
Yes, I have a question for our legal counsel. There was a question if the AG had reached out and asked us to stop this. Would that be typical?
No, it would not.
Thank you.
Other questions? Councilmember Fry.
Thank you, Mayor. Jennifer, has the Attorney General seen this proposed ordinance? Do we know that?
I have not shared it outside of city staff and
that
electeds.
Was earlier this morning that we got it for the first time.
That's correct.
And thank you.
Jennifer, is it typical for the Attorney General to see an ordinance before we pass it?
Not in my experience.
Thank you. The chair now recognizes a representative from the Wichita Police Department who can come up and answer a couple questions if possible, and we appreciate your patience. And to the medical community, if you are able to stay on for any medical questions that might arise, we'd appreciate that. However, we're for the testimony as well. Welcome, sir.
Chief Ramsey.
Just a quick question. One of the things we're trying to avoid is another lockdown. during the lockdown, there was some concern that issues of domestic violence went up. That when people were in lockdown, that victims, we saw those numbers rise. Can you confirm that?
We were observing an increase in domestic violence before COVID, and there was a slight jump in the increase, but it was already trending up before COVID.
Okay, so it was a slight jump since the increase. During the lockdown, did you and your officers experience any other undue stress while trying to enforce the lockdown?
Not anything noticeable, no, sir.
The chief told me that he felt that the lockdown was causing more problems with folks who were concerned about being locked down. Is your experience that that wasn't the case? That policing has continued with or without the lockdown with no issues?
Anytime people are cooped up, as it were, under a lockdown order, you're going to have a lot more family stress, and we did see some of that.
More family stress. How do you guys become aware of family stress? Is it because it magnifies itself as a crime, or do you get called out for those situations?
Mainly report calls.
So when people are cooped up during a lockdown, it actually causes more family stress, which includes more policing. Is that accurate?
I would say that's a fairly accurate statement. Yes.
So therefore, if we wanted to relieve family stress, issues of domestic violence, and also your work burden, we should try not to go to another lockdown. Is that a correct statement?
We work at your pleasure and leisure, so I can't say if that's correct. What I'm saying is I just cannot answer that.
Okay, well, and I apologize to put you on the spot. My conversations were with Chief Ramsey, and it seemed that a lockdown caused your folks, and I think other folks, and particularly domestic violence. We've had the domestic violence community reach out to us during this, and wanted to just kind of get on the record about how avoiding a lockdown has more than just an economic impact.
Right. We did see a slight uptick in family violence during that period.
Thank you, sir. Is there any other questions for the officer? Chair recognizes Vice Mayor Claycomb.
Thank you, Deputy Chief Salcido, for being here. Have you seen the ordinance that we're being asked to vote on today?
I have not perused it, ma'am, no.
Okay, thank you.
Councilmember Johnson.
Thank you, Mayor. I just wanted to call to your attention. I saw that Councilmember Bluebaugh's hand was up virtually.
Thank you. Chair recognizes Councilmember Bluebaugh. There's usually a delay with the phone, so.
Can you guys?
Yes, sir. The floor is yours, Councilmember.
Okay, you guys can hear me now. Deputy Chief, I appreciate everything that you guys have been doing, especially I know that you've been under a lot of stress with the protest, and I just wanted to see if you had a good grasp on how you guys would be able to handle and enforce such an ordinance, or do you believe it would overwhelm our current 911 and police response?
Anticipating this very question to come up in our city, we had actually reached out to peer agencies around the country, or Chief Ramsey had. And for us, and what we found out was that there are three components that are very important before you go into strict enforcement. It's education, information, and officer discretion. Very lastly, we enforce, and we would enforce this ordinance as we enforce any ordinance you give us. I think the position you find yourselves in as a government body, I wouldn't want to be in your spot because this goes to the very core, and I think you need to understand that this deals with the Fourth Amendment. We would detain a person, identify them, and get through those issues. So it's not a very simple, here's the citation, go about your merry way. It involves a lot of things, and I think we would engage in education, information, and officer discretion before we went to strict enforcement. Ideally, if this ordinance passed, I would like for our officers probably to have 100 masks, even if they were just cloth masks, that we could educate and hand one out. Because there are populations in the city, and I can tell you how much a mask costs at Dillon's. It's $4. So I don't know if they can afford it, but that's I think that would be paired up evenly. Totally you're doing, but that's our view. That's my view.
And that would hopefully be the intent, is that we value education and influence and arm our police officers with the resources to hand out masks. My understanding is that when we had the lockdown, education was incredibly effective.
It was powerful, yes.
And that we didn't actually have to go towards any, even to those, I remember one case where there was a business owner who was outright defiant and putting members at risk by bringing about 70 people into a closed space. The officers went out there and asked them not to do that anymore. He was still defiant, and then called back and said, okay, we won't do this anymore. So education has apparently been working. Has that been your experience as well?
That is correct, yes.
So therefore, those who might be worried about the fines that are here, which are quite modest, as long as, hopefully we won't need to actually get to those, given our recent history of and success of education.
Yes.
Councilmember Clendenin.
Thank you, Mayor. So I know I'm not a lawyer, and so I did go to school and can read. I'm going to read from the Attorney General's memorandum to Kansas prosecutors and law enforcement based on the mask order and the county's authority on that. It says if a county commission has exercised this new statutory authority and issued a less stringent order, then the more stringent aspects of the mask order are not in force and effect in that county and may not be enforced. So to our legal team that's here today, if the county has made its decision and the Attorney General says that because they made that decision that a mask ordinance cannot be enforced because they made it less stringent, how can we pass a law that makes our law enforcement enforce a mask ordinance?
Jennifer Magana, City Attorney. Councilmember Clinton, to clarify your question, again, this is an Attorney General's opinion analyzing the executive order and I believe the 2016, House Bill 2016 out of the special session, that interpreted statutory framework. Again, the analysis to see whether a statute is preemptive is a process. We believe, again, under home rule that, first of all, there has to be a clearly stated area of law that clearly conflicts. This, in my opinion, has not occurred, and we believe that home rule is not in conflict with anything in Chapter 65 at this time.
So what you're saying then is that an ordinance, if we were to create an ordinance that goes against or in opposition to what the county commission had ruled, then we do have the ability to preempt the Board of Health and a decision that they make. We can go around their authority, I guess, is what you're saying.
In legal terms, this isn't going around or particularly contradicting that action. This is acting independently and apart from that framework under the city's home rule ordinance.
And you believe the Kansas Constitution allows us to act independently in this case, based on the law?
Based on what I've analyzed, we have that authority under home rule.
Further questions? Thank you, officer. We appreciate you being here.
Thank you.
Mayor Whipple, this is Dr. Reddy. Could I comment, please?
Yes, of course. The floor is yours.
Again, this is Dr. Rebecca Reddy. I'm a pediatrician in town locally, and I just wanted to clarify the comment I think that Councilman Clendenin may have inadvertently made when he stated that we were scared of COVID as healthcare professionals. We are not scared. I feel that we are extremely concerned and also outraged, potentially, that our community has not been able to come together with such a simple ordinance as masking to protect our citizens and our patients. We also, I don't know that I have ever in my career seen a group of professionals, my colleagues, come together with such bravery in the face of caring for patients who potentially will infect us with a disease that kills us. And I know that he did not mean offense, but I expect the same kind of bravery from my elected officials. And I know that many of you as city council members feel that you're being put in a difficult position, but I expect bravery of those who I vote for. And I just don't understand the politicalization of this issue. And I ask you all to examine your conscience and the medical professionals that take care of you and your grandparents and your children, and show bravery in the face of your uncertainty and concern about your own political future. Thank you so much.
Councilmember I need some water. Sorry, Councilmember.
Right.
Councilmember Clendenin.
Yeah, no, thank you for your comments. I actually was not, my comments were not directed at the medical community, but at those from the community that have emailed us and comments made to me. There is fear in the community. So definitely was not directed at you, and I apologize for any offense I may have perpetrated there.
Other comments? Do we have any opponents who are in this room? See none. Megan, do we have any public comments of people who feel they need to speak at this point? Or over at Century 2?
Mayor?
Yes.
John Hale here at Century 2. We do have some public comment.
Very good.
First person. Yeah, state your name clearly, your address the council.
And for those who are commenting publicly, we ask, you have up to 5 minutes. We ask, of course, that you try to stay within those public comments over that time frame. It's at the chair's discretion, but we welcome you and we thank you for being here.
Alrighty, hi there. So my name is Aaron Mounts. I live at 538 North Florence Street in Wichita, Kansas. I'm a resident of District 6. So first of all, I'd like to thank all the honorable council members today for calling this meeting and being here to talk about this very important topic. So I am currently a student at Wichita State University. I take a 4-course load during the fall and spring semesters. I'm also double majoring while we're working 40 hours a week. And I also suffer from some health issues that put me at risk. If I were to get COVID, I could potentially die. So since the stay-at-home order was given, I have worn a mask almost every single day to work during every single one of my shifts, even if I'm the only employee who does. Over the last few days, my work has definitely improved. More employees are wearing masks, especially I work at a hotel, so our housekeepers are all wearing masks and all the front desk are wearing masks. But I've noticed that only 10 to 20% of people, specifically guests who come into the hotel, are actually wearing them. And the only ones who do tend to be from high impact areas like Arizona, California, Florida, things like that. So my opinion is that mandating a mask order is paramount in protecting our essential workers like me and my peers. I know that the county commission was concerned about the ability to enforce such an order, but I am also concerned because I'm the one who has to enforce that policy at my job. But this isn't something this isn't brand new. We've seen things like this before, such as the, if I can find it, the Kansas Indoor Clean Air Act that was passed. I remember I was just a child when that was passed. And I still remember, I suffer from asthma. I would go into restaurants and I'd have an asthma attack. Things like this, like I could have died simply from that. And so this is an issue that we're still facing, and this is an issue of public health. So I would say that if the council were to say strongly, quote unquote, recommend wearing masks like the county commission did, it's not going to do anything. I've seen what what strong recommendations do, and that's basically a way for government to say that they want to support something, but not actually go out and support it. So I'm going to leave you with this. My job lost countless thousands of dollars during the stay-at-home order. We are lucky to have gotten through the COVID issues and all the fun stay-at-home order stuff and our huge drop in occupancy. But we can't handle another lockdown. We will probably shut down if there is one. So if a mask mandate is not ordered, I will possibly lose my job, and because of other people's negligence, I could possibly die. And you all have the power to prevent that, so use it. Thank you.
Thank you. Vice Mayor Clayco.
I have a question for the speaker. Sorry, I let you get away.
Sorry, yes, I'm open for questions.
That's okay. Thank you for being here today. I just wanted to ask, if we passed an ordinance, how do you think your place of work would enforce that? What measures would you think you would use?
Just the same way that we enforce our current no smoking policies in our lobbies and in our rooms. We ask the people to leave, and if they don't leave, we do have to call the police.
Okay, thank you.
So in your profession, if you were to tell someone, hey, the law is you have to wear a mask, that would be stronger than saying, hey, it's recommended that you wear a mask.
Yes, that is very much correct.
Other questions for the conferee? See none. Thank you, sir.
Thank you.
Next speaker, please. Welcome.
Hello, can everybody hear me?
Come closer to the microphone if you could. There you go.
Can you hear me now?
Yes, ma'am. Thank you for being here.
Thank you for having me. I appreciate you all being here today. My name is Pamela Clarkson. I live at 3420 East Navajo Lane, and I work for the City of Wichita at the library. I have not been able to go back to work since our lockdown because I have a small child and I have to stay home with her. I will be running out of leave in the next month, and I don't know what I'm going to do then, depending on what schools do. We're doing okay since my husband works, but another shutdown could put his place of work out of business as well. I want to ask you to mandate masks because we've seen what strong recommendations do, which appears to be basically nothing. I personally know people who, while they know it's important to wear them, are too self-conscious to be the only one in a store wearing it. Don't underestimate the power of peer pressure. Also, if it's the law, it's no longer a political statement for me to be wearing this. I'm just obeying the law. It also gives businesses somewhere to go. They don't have to make it their policy and risk alienating their clientele. It's the law, everybody's doing it. So I am asking you in your capacity as stewards of our community to make decisions to protect us, to make decisions in the best interest of the community at large. I think that's your responsibility, and I think this is what will do it. I ask you to listen to what the experts have said. I'm no expert, but clearly you have a wealth of information from them. Thank you for your time.
Miss, if you wouldn't mind, you mentioned you have a child who
Yes.
has a condition. If your child, if these numbers continue and spread gets throughout our community, this would be a big health issue for your child. Is that an accurate
She
statement?
has no special health conditions. She can't be by herself, and my other childcare options are all high-risk populations. So that's why I'm watching her. She's as healthy as any kid, but the infrastructure that schools provide as childcare is so important to our community. We live in a community that you need to have 2 incomes to make it most of the time if you have a family, and losing that childcare puts a serious dent in that.
We appreciate you giving a perspective as a parent. Thank you so much. Other questions?
Thank you for having me.
See none. Onward to the next speaker.
Hi.
Two's feed seems to, oh, there we go. It seems to froze. Welcome. Thank you for being here.
Thank you for having me. My name is Anitra Stewart. I currently reside in District 2. So the first thing I'd like to say is that the Economic Policy Institute says that Black and brown workers are, that Black and brown workers are disproportionately affected by coronavirus in general. This happens through a variety of means. According to the Economic Policy Institute, Black workers make up 1 in 9 workers overall. They represent 11.9% of the workforce. However, Black workers make up 1 in 6 of all frontline industry workers. They are disproportionately represented in unemployment, in grocery, convenience, and drugstores, 14.2%, public transit, 26%, trucking, warehousing, and postal services, 18.2%, healthcare, 17.5%, and childcare and social services, like the person before me mentioned, 19.3%. While in the next near term, this protects them from job loss, it exposes them to greater likelihood of contracting coronavirus while performing their jobs. In addition, according to the CDC, Hispanics account for, in addition to that, in general, people of color are disproportionately affected by coronavirus in general. According to the CDC, Hispanics account for 34.4% of all COVID-19 cases. Blacks and mixed people account for 24.9%. Asians make up 3.4%, and Native American people make up 1.8% of coronavirus cases. Respectively, Hispanics account for only 18.5% of the population. Blacks and mixed people, about 16.2% of the population. Asians are underrepresented in this category at 5.9% of the total population, but they make up actually a lower percentage of coronavirus cases. And natives make up about 1.5% of the U.S. population. So this means that minorities in general make up about 42.1% of the population, but 64.5% of all coronavirus cases are people of color. So in order to protect the most vulnerable people in our community, I am asking that that we go ahead with this legislation because, like all of the people before me have said, masks help reduce the spread of coronavirus, which is currently affecting our communities of color disproportionately. And if we care about our communities of color, then we will do things with our system that would make it so that this statistic isn't the case.
Are there any questions for the conferee? See none. We thank you so much for being here.
Anyone else in this room?
Next conferee, please.
Alrighty, Mr. Mayor, John Hale here at Century 2. I'm going to be switching you over into the other conference room. We're done with people in this room. One moment, please.
Thank you. Hello.
Hello?
Floor is yours.
There we go. You can see yourself right there. Okay.
Welcome.
Good afternoon. Can you hear me okay?
Yes, ma'am. We do. We can.
My name is Brianne Bradley. I'm a nonprofit accountant, wife, mom, and a Wichitan for the past 10 years. I'm speaking today as a citizen and constituent of the 5th District. I am by no means a medical expert, but I trust and value science and our experts. I've come here to voice my support of the mandatory mask policy. The science and data is becoming increasingly clear. In areas where masks are mandatory, the spread of coronavirus is significantly mitigated. If there is a policy around using face masks in place, it has a direct and significant impact. Our country was founded on personal freedoms and liberty, but personal freedom without personal responsibility and accountability is chaos. And unfortunately, it's been proven to us that a large swath of our citizens feel little obligation to keep those around them safe via mask wearing. Recommendations don't work. If you go to any grocery store or gas station wearing a mask, more than likely you're the odd man out. That's been my experience, at least. I love my country and I love my city, and by extension, I love my countrymen and my fellow Wichitans. I feel a duty to do what I can to keep them safe and healthy, so I consider mask wearing my patriotic duty. But sporadic mask wearing is not helpful in reducing transmission. Patchwork policies don't work. In order for the masks to be effective, they must be ubiquitous. One purpose of our government is to ensure that the good of the collective whole takes priority over individual whims and feelings. Masks to save lives, and the lives of Wichitans are on the line. Years from now, when we are looking back, we will be able to look at the choices made by our governors, our county commissioners, and our city council members and draw a direct line to the consequences of those choices. Back in April, there was an outbreak in my hometown of Grand Island, Nebraska. It spread like wildfire in the small town with a population of 50,000. At one point, Grand Island had the second most cases per capita, right behind New York City at its peak. I was in a constant state of fear that I would lose my parents without being able to say goodbye or be with them in their final days. So far, approximately 50 Grand Islanders have died in the span of 3 months. If we lost Wichitans at the same rate, that's almost 400 families left reeling and traumatized. That's 400 Wichitans dead by September. That's 400 mothers, fathers, grandmothers, grandfathers, sisters, brothers, daughters, sons. That's 400 families with an empty seat at Thanksgiving dinner. Being a hotspot in a global pandemic has consequences that will last for years, financially, economically, politically, and emotionally. Please consider the weight of these long-term costs in comparison to the short-term cost of having to wear a mask in public spaces. With so much at stake, I believe the choice to be clear. You must vote to implement this mandatory mask policy. It is the best way to ensure the health of our economy and the health of our citizens. Despite what some of our leaders seem to think, ignoring the problem will not make it go away. We must make the hard decisions, and as elected officials, that responsibility falls on you. I implore you to use your power to do the right thing. Ensure that you can look back on this years from now and know that you helped save lives. Thank you.
Thank you for being here. Any questions? Next speaker, please.
Is it time? Yeah. Whoop. Yeah, you should just stand right here. Can you hear me?
Yes, ma'am. Thank you for being here.
Thank you for having me, Mr. Mayor. I've been trying to talk to you for a minute now. If you can read my mask, it says no. I have a question for you, Mr. Mayor.
So during a presentation time, you're supposed to present, and we're not supposed to be able to answer questions because we could have the possibility of taking up your time. So go ahead, just
that's okay.
Feel free to speak freely.
So, as a governor, mayor, sheriff, I believe that all those people have taken an oath of office to get into the position that they're in. I believe the oath of office says that I do so solemnly swear to protect and uphold the Constitution against foreign and domestic enemies. I take this freely and without evading my duty to public service. Okay? We are wearing masks to prevent another shutdown. In the shutdown ordinance for Kansas, and I tried to talk to Governor Kelly about this 4 months ago, it says that unless you are an essential business, you must shut down. I don't know if you're familiar with the 14th Amendment that was created after slaves have been freed, okay? They wanted to buy land, and they made a law. They said, you cannot buy land unless your grandparents owned land and can buy land also, okay? So this is where the 14th Amendment comes in. Every American born and naturalized has the opportunity to pursue life, liberty, and happiness, here's the deal, under equal protections of the law. So if it's my dream to sell Barbie dolls, and it makes me happy to make a living selling Barbie dolls, and my neighbor wants to sell groceries, it is not constitutional for anybody to make a law that says I have to shut my business down, but my neighbor doesn't. There's more, hold on. In March, my mom was suddenly paralyzed from the waist down, literally, suddenly paralyzed from the waist down. I have one child. Suddenly, I'm responsible for her 3 others. She went into the hospital. They ran tests in the hospital for a month by herself, no visitors. She got diagnosed with Guillain-Barré syndrome. You know what the most likely thing to cause Guillain-Barré syndrome is? The flu shot. If anybody else wants to take the flu shot, they're more than welcome to. Doctors, you said that cloth masks were helpful in preventing the spread of coronavirus. I would have to debate that in the fact that if you can't see something, it must be smaller than something you can see, right? So coronavirus is probably a lot smaller than baby powder. I have a little, it's Schedule 80, 2-inch Schedule 80 PVC pipe right here with a cloth face mask on the end. My aunt gave it to me to keep me safe. It's cute, got a bunny. There's baby powder in here. And I really work hard for my money, and I don't want to waste it on a mask that when professionals wear this every day, they change it often. These are not reusable masks. These are disposable masks. Why would I spend my hard-earned money on a mask that I don't even want to wear? I think I'm done. Any questions, or do I stay here?
You're actually right on time. I just want to thank you for being here and tell you how sorry I am to hear about your mother. That sounds
Don't worry about that.
terrible.
No, we're not here for feelings.
Thank you for being here. Next conferee, please.
That's all we have here, Mayor.
Thank you. With that, is there any other folks from the public who would like to speak to this topic? Any other questions or comment or discussion on this topic?
From the public or?
From the bench. We're wrapping up.
Mayor?
Yes.
Mayor, I have one more gentleman who would like to speak.
Yes, let's hear that gentleman, and then we will return the conversation back to the bench. We do want to reward those who have been patient and came out on this holiday weekend to have their voices heard. Thank you. Welcome.
Hello. Thank you so much for speaking. My name is Joseph Clarkson. I live on 8619 East Wassell Street. I would just like to say that I work an essential job at Panera Bread. This is actually my Panera Bread mask that I'm wearing right now. And I live with my mother and father. My mother is immunocompromised, has been for a while. And I live in fear that I might catch this disease, that it could spread, that it could infect her. I love her and it could kill her. So I wear my mask at my job. I'm pretty much the only person who does. Maybe 10% of the guests who come to eat come in wearing a mask. And I think we've seen clearly that strongly recommending that people wear masks does very little. So I'm here to strongly encourage you to vote yes to make it mandatory. That way the people who come into the store would be wearing masks. The people who work at the store would hopefully be wearing it properly instead of just down below their chin like they unfortunately do. You've listened to the experts. I am not a health expert, but you've talked to people who are, and they all say that wearing a mask is how you prevent the disease. I don't think anybody here wants to be sick. I don't want to be sick. I don't want my mother to die. That's really all I had to say, and thank you so much for your time.
We appreciate you being here and voicing your opinion. Are there any, I have a list of folks who are going to speak after, but is there anyone who would like to ask a question? No. Thank you so much for being here. We appreciate it.
Thank you.
Are there any other comments from the public If not, we'll bring discussion back to the bench. The chair recognizes Vice Mayor Claycomb.
Thank you, Mayor. I was wondering, are we ready for technical questions on the ordinance or just comments? I have some questions for legal counsel on the ordinance. I know there's not a motion yet, so.
No, and normally, yes, and I get that. In a legislature, you do a motion to pass it out, a second, then you debate the ordinance. Here, we usually do all of our discussion and comments, and then we make the motion. So though there isn't a motion yet, yes, we can discuss the order now because the conversation has come back to the bench. So I'm hoping that the ordinance, excuse me.
Okay.
So that I think is in order, of course. But
Okay, so I think these are directed at legal because they're technical questions on the ordinance. My first question is, to me, it looks like item 1C is in conflict with item 2E. It says that, it says obtaining services from healthcare sectors, including dental offices, you have to wear a mask. But in the exemptions, it says persons who are obtaining service involving the nose or face, for which temporary removal of the mask covering is necessary to perform service, they're exempt. I just want to make sure that we don't pass something if we do have a motion at some point that's in conflict. It would make us subject, I would think, subject to lawsuits.
Yes, Vice Mayor Jennifer Magana, City Attorney. This language was patterned largely after the executive order. It's not adopted as under authority of the executive order, but it was language used for that purpose. This language can certainly be modified if you have suggestions.
Okay.
It can certainly be altered, revised as you wish.
Because there's another one too. It's item 1E and item 3G. And it talks about individuals being outdoors, not being able to maintain 6 feet, and then there's an exemption for that, for athletes. So I just think that we should be clear.
Yes, and I must recognize it is difficult for someone to draft these type of things in without, some language that's going to raise a question or be considered a conflict. So certainly open to any suggestions that we have to clarify.
And then in section 4, number 2, it says a person, firm, or corporation convicted of a violation shall be punished by. I'm trying to figure out who's liable.
That language is similar to other ordinance penalties we have in other ordinances. It's patterned after existing. So in those cases, it's a factual question to determine who is in charge, who had acting authority, who might be the person that is corporate authority. It doesn't come up that often, but that is the language that is in our current ordinances for other violations.
So it would be up to the police?
It would be a factual question for the police, and then the prosecutor would look at it and what's really, a rational approach, what's factually supported, who would have had knowledge, who would have had authority to make a decision. It's just a case by case.
Okay.
It just doesn't come up that often, but it is accepted language.
Okay. And then on the agenda report, this says that this has no financial considerations. But I think the police are going to be, if they're going to have to be educating, informing, and I can't remember what the third one was, before enforcement, I think there is going to be a financial consideration if they're going to be asked to do extra work outside of what they normally do.
And that is certainly something that I think the police department and finance would weigh in on in a process.
Okay. Thank you. I think that's.
If I
I think
could
those are all
on
my
that one,
technical questions.
we don't anticipate that there would be additional staffing. What it would do, it's a matter of distribution of workload,
Yeah.
right? So I don't know that you can put a financial, or that you can put a number on that. It's a matter of moving, of priorities, right? And moving away from some type of calls in order to be able to do this
So
work.
it should probably be somewhere in the agenda report, because there will be a staffing implication then, even if it's not a financial one. So,
It's a matter of workload, yeah.
yeah. Okay, I think that was all my technical questions. Thank you.
Councilmember Johnson.
Thank you, Mayor. I too had a couple questions, but before I get to my questions, I want to kind of state my position because I've seen how some of our questions get portrayed in the public. So first, as an elected official, I feel it's my job to do what's in the best interest of the public, and especially public safety. As a member of the Black Alliance and being a Black man, I think it's my duty to do what's best and in the best interest of populations who are more at risk to catch COVID-19 and more likely to die. And we've seen this virus have a negative impact on Black people around the country and in the state of Kansas. And I've heard from folks who've had it and had family members pass from having it. And I guess my last point is that I definitely take this virus seriously and am typically supportive of any effort that keeps the public safe, including wearing a mask. And my hope is that everyone watching wears a mask right now. But I do have about 7 questions I wanted to ask, particulars regarding the ordinance. And again, it's not that I am opposed, because I'm not. I just have some information I'd like to get some answers on. So my first question, looking at section 3, 2A, just for clarification for me as well as the public, is this basically saying that if you are at work, you need to be wearing a mask? And I ask that just looking at the wording in general, like I have a nonprofit organization, public can come into that office. They don't always come into that office, but if I was in there, the way I read this, I need to wear a mask. Would that be accurate?
Jennifer Magana, City Attorney. Councilmember Johnson, I think the courts would give ordinances the reasonable reading or the ordinary meaning of words would be applied. So I think it's reasonable to expect that from this language.
Okay. For section 3.1a, although this speaks to indoors, I automatically thought homegrown. So using that type of business model that has indoor and outdoor spaces for folks, would it include a business like that that has already maybe taken precautions to socially distance? Would folks who are sitting at a table that was open, still 6 feet away from another table, would they have to wear a face mask as well?
I'm sorry, you section 3.1a, is that?
Yeah, 1A. Okay. It says inside in any indoor public space, but there was another section I forgot to mark that talked about outdoors as well.
I think, again, it would be given the practical reading. So if distancing is just not possible, I think masks would be required. But where distancing is possible, I think that's the exception.
Okay. Then section, I wrote that wrong. So section 3, under the business and organizations, looking at the exemptions, B, persons with medical condition, mental health condition, or disability that prevents wearing a face covering. This includes persons with a medical condition for whom wearing a face covering would obstruct breathing, or who are unconscious, incapacitated, or otherwise unable to remove a face covering without assistance. That, I just wanted clarity for the public. I represent an area called the Timbers, which is a community of Wichitans who have one or more health conditions or disabilities. I've had a few members of that community ask, would this apply to them, because some of them cannot physically put on a mask, or if they have one on, it could be detrimental to their health. So by reading this, I would assume that answer is no.
I would agree.
Okay. And then while we were talking, I also tried to catch YouTube and some social media comments. Would that also apply to individuals having asthma, serious asthma, not a light asthma?
Well, this language has medical conditions, so I think that's a broad phrase that could include that.
Okay. And again, I just want this information, not only for myself, but folks watching as well. And then Vice Mayor brought this section up, but section 4.2, I believe, looking at the potential violations. I think enforcement of this would be necessary for some people to take serious, but my only concern is looking at low-income communities, and I bring that up because this morning I just drove by a few dollar stores and other areas, and I saw folks in lower income areas not wearing masks, and I would hope that even if we affirm this today with this potential penalty, that law enforcement would hand out some of the masks that they got, and think about the potential for the downward spiral of a poor individual getting a ticket that is $50, $100, or $200 and what that can actually do to them. And if, you know, if we kept it that way, I understand the need for enforcement, but if there was also some other alternative that maybe we could think about today to help out in those types of situations. Just had a concern on that. And again, I don't know if my colleagues want to talk more about what a potential penalty on that could be. The other piece of that was it was recommended by 3 people I have received, and then I didn't get through all 1,000 or so emails I've got, but looking at also, rather than penalizing the individual, putting more of the onus on businesses, because they have, as many have said, come up with practices to make sure folks either have a mask before they enter or they're monitoring that. And I think that would help maybe add a little bit more control to this. If you know you walk into a business, you have to wear a mask. And if they are in many ways liable of that, then I'm sure they would make sure that people are wearing a mask when they are in that space. And again, I think that helps take some of the potential exposure to poor people to have tickets that could cause that downward spiral. And again, just having this dialogue, because that part concerns me. But I think that businesses who have these plans, who have been implementing it, might be able to help us out quite a bit more on this. My last 2 things. Section 5 says that this is in effect until modified by the council by repeal or extension. So essentially there's no ending date, which will allow us the flexibility to monitor spikes in the city and potentially vote at some point to end that. Would that be an immediate ending, or would it have to go to a second reading since it's an ordinance?
Councilmember Jennifer Magani, City Attorney, this language is similar to other ordinances in the way that it can be repealed or modified. Council has authority to create a particular sunset date or another mechanism for the ordinance to become repealed. That's direction I welcome from the council, if that's the decision you want to go with. That's just language that we patterned other ordinances. So you can build in a sunset, or you can build in a mechanism that would create the ordinance to come to an end.
Okay. Well, personally, I'm not making a motion right now. I would like us to consider setting a 30-day review of sorts, so that way we aren't last minute coming up with, let's end this, and then trying to put together a report and bring that back to council. If we had a 30-day review that was maybe the first week of August, where we could look at what the trends have been, and then we could say at that point we want to vote to end this or not. But I'd rather not just leave it open-ended. And with that's all the questions I have. Ultimately today I'll be supportive of this just because of the risk and where we are right now, and hearing our medical professionals and knowing the impact this could have in lower income communities and communities of color. But I do want to make sure that in our haste to address this, that we get this right and try to think through unintended consequences. So that ends my comments, Mayor.
Councilmember Tuttle.
I wish I would have gone before Councilmember Johnson, because we seem to be thinking along the same lines. But the end date part, Jennifer, was something that was going to be an issue for me. And the last thing we want to do is have to call another special meeting to repeal it like we did today. And so I think that needs to be cleaned up. Also, 4.2 seems to be an issue for many of us, Section 4.2. In my mind, am thinking of if I go into, let's say, a restaurant and our server isn't wearing a mask, does the server get the fine, or does the restaurant get the fine? And then, many restaurants or businesses are large corporations and chains, so are we sending a $50 penalty ticket, whatever you want to call it, to some place in another state and they don't even know what it is? So again, back to the financial burden, there's just going to be some logistics that we have to work through. And then also, I echo Councilmember Johnson that while it was said that the fines are modest, to some people that's not modest. And I don't necessarily have a better solution, but I do worry that if somebody's not wearing a mask, it could be because they can't afford one, they don't have access to one. And so then fining them isn't helping the problem at all. So just kind of want to maybe think through that, but it would be a little confusing to me of who's going to get the fine, and then where's the fine, or the, you know, how does that work? So, and then the end date. So thank you, Jennifer.
So I'm going to take a chair's prerogative and recess for 1 hour so that members of the council can meet with legal with proposed amendments one-on-one, and then we can come back, and if we need an additional hour, then I will recess for an additional hour. My talk list has Councilmember Fry on it, and he will retain the floor after the recess. We are in recess.
Can I ask a question?
Parliament procedure. Go ahead.
Yes.
Can the mayor call a recess without a vote?
A recess can be made at a reasonable time and for reasonable purposes during the meetings, providing such request shall not be made during debate or discussion, or immediately prior to a vote, or for purposes of influencing a vote, or for harassing other members or individuals appearing before council. That's what the city ordinance says.
And I wanted to be clear, knowing the ordinance, that it is so that the members who have expressed that they would like amendments to be made to this document have a chance to get those amendments prepared so that we can move forward and ensure that our community stays safe before the 4th of July, as our medical professionals have suggested, and have a product that doesn't have the unintended consequences. So with that,
I will say, if this is during discussion, though I don't know if discussion is still occurring or not, but recesses are thought to be
so
during discussion.
we would go to Brian Fry, and then if there's no further discussion, I will recess for 1 hour for the opportunity for amendments so that we can.
I have my hand up too, Mayor.
Yeah, Councilmember Blueboy has.
Where? I'll see Bluebog and I see Johnson. And if during the discussion, and I apologize for being out of order, but if it starts to show that members are okay with proceeding and doing the amendments on Tuesday, then that's good as well. I just don't want to waste staff's time in this day, with just some of these, I think, smaller things that could be clarified, with a one-on-one with legal. So, maybe I won't recess if people seem okay with it. Just want to make sure that we pass a good product and we're not moving too fast. With that, and I apologize, Councilmember Bubak, I don't, for some reason this tablet doesn't have you here. I have Fry, I have Councilmember Johnson. You saw Councilmember Bubak before then. Is he in front of you or behind you as far as speaking? Or are you unsure?
Well, this time I didn't see. His hand is up on the...
But you're on the list as well. Do you know if his hand went up before you or after?
I wasn't looking at that.
Very good. Well, I'll have him in afterwards then. So the list now says Councilmember Fry, Councilmember Johnson, Councilmember Bluebog. Councilmember Fry, you're on the floor.
Thank you, Mayor. So there's a lot to digest here. I find the entire ordinance extremely vague, with no ability to provide regulatory guidance. The lack of details, especially as it relates to due process, enforcement, it feels like a one-size-fits-all approach. Many holes. Similar concerns with the executive order that the governor issued last week, and maybe that's why so many counties have rejected it. I feel like we are hastily making a decision that we are not fully educated on the medical science behind this. Yes, we had a lot of good input today, and I appreciate all those that spoke, but as we've stated before, we're not the Board of Health. That is the county's role. And they have been monitoring this every day with much greater detail and much greater access to numbers and data than we have. And so I'm kind of in a dark spot as it relates to how much we really know and how much truth are in all of these numbers. I don't feel comfortable making a decision on a Board of Health issue when that is not our purview, that is not our role. By statute, this should fall on Sedgwick County. And for us to say otherwise feels like a gross overstep in our role. Should we choose to wear masks, socially distance, and practice safe behavior? Absolutely. But should we use government power to exercise and adopt those behaviors? I have a tough time supporting that given the limited amount of time we've had to review this. We just saw this ordinance early this morning, And I think there have been times in the past where we have asked the Attorney General to give us an opinion on something that could be controversial, to avoid potential litigation. And I would hope that we could do that before we make a decision on this ordinance. Seems like a lot of effort that could just be a de facto recommendation. Thank you.
Councilmember Johnson, and then we'll go to Councilmember Bluebock.
Thanks, Mayor. I was gonna say I disagree with the recess because we're all here at the bench, and I just figured we should just hammer it out now and make the sausage while at the bench rather than take an hour recess. But I also want to say I do agree with the sentiment of Councilmember Fry in the sense that we did just get this morning, so I understand that there's a lot of reading through here, which is why I ask more questions than I normally do. I had about 3 hours to read through it, but I think we definitely should not recess and have this conversation today, right now, about some of the issues we raised, because it wasn't a lot of changes. It was just concerns about penalty. I know that there were some constitutional concerns there, but the other pieces were just some wording and alternatives to find. So just wanted to share that.
Noted. Thank you. Councilmember Bluebock.
Can you hear me, Mayor?
Yes, Councilmember, you are well heard.
Thank you very much. You know, I don't know exactly who drafted this. It did come across very fast. It seemed like someone put a lot of thought into it, but I don't, you know, none of us got to look at it and evaluate it. I have a lot of questions on it. It does feel very rushed, as my colleagues have said. And I just have to question where we're at as a city right now. Whenever, you know, we've made the decision when people have a fix-it issue with their car, we're giving them a voucher to get their car fixed. But yet with this crucial issue, we're going to fine and set up a fine schedule. I would think that we're trying to push toward people to adhere to the rule rather than just fining. So I think we have a lot of work to do here, and I'm not ready to go forward with what I've seen today.
So for those who are wondering, the ordinance is 4 pages with variant spacing. It's not longer than 4 pages. So if we need more time, I'm happy to recess. I'm happy to call a meeting tomorrow. I'm happy to call a meeting tonight. What do we need to do? It seems like people are okay. It seems like it's okay with the with overall the concept. But if we want to get some of these technical stuff knocked out, we can do that at the bench. I'm happy with that. For example, let's entertain a motion. Let's go down the list. Let's entertain a motion or an amendment to the fine structure. Let's ensure that discretion and ensure that education is written in there, so there's no confusion. So, Councilmember Johnson, guess we're still doing discussion. Councilmember Fry.
Thank you, Mayor. I would like to entertain a motion I'd like to make a motion that we delay a decision on this ordinance until Tuesday council meeting to give the public ample time to review this ordinance and weigh in. As we've all talked about, we're not legal scholars up here, and if we can get some of our friends in the community that are to look at this and also maybe get an opinion from the Attorney General, I think that gives us time for transparency and for visibility and input from the community at a time when we absolutely shouldn't rush into this. You know, when we're talking about protecting health or protecting liberty, I think the July 4th weekend, we deserve that opportunity. So that's my motion to defer decision till Tuesday.
Second.
Motion is made and seconded. The motion is debatable. I rise to a parliament inquiry. Madam Parliamentarian, if this motion is made and this is tabled, can I call a special meeting in 2 hours and have a new draft delivered?
I'm sorry, I didn't hear the last part of your question.
Can I call a meeting, even if this is tabled as in its current form, can I have an amended form come up with a special meeting with 2 hours' notice? Is there anything in the city code that prevents me from doing that?
If this motion is deferred until Tuesday,
Then a current document would be deferred, but a new document can be presented in another emergency meeting in 2 hours. Is that correct?
another document?
Another ordinance, yes. A variation of this ordinance, one with the amendments that people wanted to make at this bench, but now are being denied that opportunity.
You know, there is a limit on motions to reconsider. If it's viewed as a motion to reconsider, then no. I think there's authority in the ordinance for the mayor to call a special meeting.
Thank you. Just want to make sure people know that as we entertain this motion, that I could make a special meeting in 2 hours with the amendments put into this document for those who want to work this through and make sure we follow the advice of 10 of our medical professionals who said it is dire that this is done today. There has been a motion and a second. Any discussion on the motion? This motion is a table.
Can I ask a question?
Yes.
Can you repeat the motion, sir?
Pardon? So I have, if the clerk will close the roll, this is a debatable motion, and therefore I have Councilmember Tuttle, Councilmember Bluebog, who on the list, and I can't see any other list because the roll is open right now, but again, this is debatable, so. Councilmember Tuttle.
There was a question. There was a question to clarify the motion.
Question to clarify the motion.
I just want to ask a question because I'll be honest, I'm a little confused. So before I push any buttons and make a decision, I want to know what I'm doing here. Because I heard a motion that we're going to defer this until Tuesday, and there was a second, which in my mind means Tuesday, right? And then I'm hearing we're going to do something in 2 hours. And so that's why I'm not sure if I'm voting for Tuesday or if I'm voting for 2 hours. So I don't know who to ask, if it's Jennifer or the clerk or someone, but, and maybe I'm the only one who's a little confused, but I truly am. So I want to make sure that I know what I'm voting for before I vote. Thank you.
I defer to the mayor to clarify his suggestion.
So my understanding, and I believe that the parliamentarian and our chair of the legal department has agreed, is that if we were to table this document, this ordinance as is until Tuesday, that will close out this meeting, and we're okay. There is nothing that prevents the mayor from calling another special meeting with 2 hours' notice to bring up a version of this document in which the amendments that have been asked for us to do at the bench today would be included in that document. That would technically be a different ordinance, and thus this one would still table, which means we could bring it up Tuesday if the ordinance at the next meeting, in which we all, I think, want to craft, was to fail. If the ordinance was to pass, this ordinance would still come up, but I'm guessing we would just go ahead and table it again or vote it down because we might have an ordinance in place by then. So my clarification was, if this tables and we wasted a day, can I, which my interpretation of our ordinance allows, as mayor, call a second special meeting with 2 hours' notice to do a variance of this type of ordinance with the amendments of those folks who are here today who asked to amend this from the bench?
I believe that if there is a different ordinance, that's a different meeting, and the ordinance allows a special meeting to be called if you state the purpose of the ordinance and provide the other information that's required.
Thank you.
Can I ask a follow-up question to Jennifer then? Okay, I'm probably not going to ask this well, but if it is this ordinance but just with revisions, that's not a new ordinance, it's just this ordinance with revisions.
Then that would call into question the motion to defer that has been voted, or that has yet to be voted on, I guess.
Okay.
So. That motion,
so it would
that
be a
motion
totally
is,
new, we can in 2 hours put together a brand new ordinance. It can't be this ordinance with revisions because it's still this ordinance.
if this ordinance is voted to defer, which that motion is pending, I don't believe that motion has been voted on yet.
Sure,
so,
sure, yeah.
So that would seem to dictate.
So just to follow up on that, the topic is still open. We would just have to do about 30% alteration to this current document, to these 4 pages. And therefore, it would be different. The topic's not off the table, but this particular ordinance is off the table.
It's hard to say because this ordinance is a work in progress as I'm hearing it.
There's been no amendments motioned or asked for this ordinance. And thus, as it is right now, there is no, through discussion, there is desire to make this a work in progress, but as it stands now, this ordinance is as written. Is that correct?
Well, this ordinance is being moved to defer for further discussion. I believe the topic of the potential second meeting would be the same topic.
Right.
So I think you have a challenge there in the motion to defer and then coming back to vote on the same ordinance.
The same topic, different ordinance. Because we'd have a different
I guess
document.
you're getting into splitting hairs there.
Right.
Sir.
Well, that's what law is, isn't it?
Sir.
Go ahead.
Oh, to follow up on my question, to answer your question, Mayor, I mean, I think if you are opting to call a special meeting for something, for this ordinance, I think this would have to be substantially different than the ordinance that's being discussed.
So my understanding is that substantial difference is 30% variance. Is there another standard that we use here at the city?
The question really hasn't come up before, so I don't have that answer.
So where do we get the idea it needs to be substantially switched then, if it hasn't come up before?
Apply some general legal standards to the ordinance. This is kind of a case of first impression, if I may.
Of course. Councilmember Bluebog, excuse me. Oh, excuse me, did Councilmember Tuttle have her question fully addressed?
I think so. Thank you. It's still a little muddy, but thank you.
Councilmember Bluebog.
Thank you, Mayor. I'm still confused because it sounds like you're asking for your motion is 2 different things, and I'm trying to specify what we'll be voting on.
Right, and just for clarification, I have no motion on the table. The motion is for Councilmember Fry to table this until Tuesday, and I am asking my authority to call another special meeting and what the options are if we were to try to follow the medical advice of the professionals who are on and what I'm reading from the bench, which is to allow us to try to work this through since the idea of a 1-hour recess apparently isn't one that people are interested in. So the motion you're speaking to is to table till Tuesday.
To clarify, the motion is to defer.
Defer till Tuesday. Good clarification. Apologies.
I don't have the option to request to speak, so.
Okay, Councilmember Bluebog, you still retain the floor. Are you finished? And I apologize that our rolls are open and thus I don't have a list, so thank you, Councilmember Clendenin. You now have the floor.
Thank you, Mayor. I'm going to offer a substitute motion to clarify things a little bit, hopefully. My substitute motion would be to defer until Tuesday, not allow a special meeting on the topic until then.
Second.
Is there, my understanding in our Rice Department inquiry is that motion is out of order, is there is no guidance in our city code that would allow, that would restrict the mayor's powers to call a special meeting. There was only guidance that the council themselves could call a special meeting. Is that correct?
If you'll allow me to check the ordinance very quickly.
Sure. I think the motion would actually be in violation and thus would be out of order.
The ordinance on special meetings says a mayor or any four council members shall have the power to call special meetings of the city council.
It says nothing that the city council nor the mayor could cancel a meeting or even cancel the power of the meeting because the meeting hasn't been called yet. Is that correct?
I believe so. I'm reading further, if you'll allow me.
Of course.
I'm sorry, I hate to break in out of order, but could I maybe add something from the medical community?
Sure, we'll let legal think, and then you may, in that time, give us medical opinion.
Thank you very much, Your Honor, and counselors. I hate to break in, and I really apologize for that. This is something I'm not particularly familiar with parliamentary procedure in these proceedings, but this is somewhat of a, well, not somewhat, this is a healthcare crisis we're dealing with right now, and this time is of the essence. When the reopening, the quote-unquote phased reopening was essentially discarded right before Memorial Day, the predicted outcome was that we would see one incubation period following that decision, the impact of that decision. An incubation period is 14 days. So it takes at least 14 days to see the impact of any intervention. And then we had Memorial Day weekend, and subsequently we've been seeing cases spiking left and right. We're about to have 4th of July weekend, and there are going to be numerous gatherings with people all over the place. There's going to be massive exposure, and if there's not action taken today, it's going to have serious health consequences. And so I just want you to be forewarned.
Thank you. That was my concern as well. Chair recognizes legal for an interpretation of the motion. Can a motion passed by a single majority supersede the written bylaws as they are?
I believe you'd have to have a motion to suspend policy. The special meetings ordinance is very simple. It says the mayor or four members shall have the power to call special meetings of the city council.
If we wanted to actually suspend the...
I'm not sure that that is a very
where we're going.
Practical approach. I'd have to do some further research on how you would do that, and you may have to do further, maybe an actual amendment of an ordinance, not just suspension of a policy.
Okay, I just wanted to help out my friends who are trying to make a motion. Therefore, the motion is out of order. The substitute motion. See that it's out of order. Other comments, and I think that the vice mayor might have had. Because of that.
I'm fine, thank you.
Other comments? With that, the first vote is to defer this until Tuesday. It is the ordinance as it stands, not one in which we discussed as a conceptual ordinance that might be coming up. So, clerk will open roll, members will cast their votes, and then, of course, the member who is by phone will have to, I believe, vote by voice.
Aye.
Mayor, I have a question. Did this go back to the very first? Is this what you're voting on, the very first, just to defer it? Okay.
The motion is to defer it. If this motion passes, it defers until Tuesday, and then the meeting's over. We'll do a motion to adjourn. With a result of 4 nays to 3 yeas, the motion does fail. Back on the underlying ordinance, is there...
Excuse me, Madam Chair, could you...
What was the vote?
Yeah, can we see the vote again, please?
I'm not able to pull it up because of the...
It said
well, can you read it?
3.
The votes?
It was 4 yeas to 3 nays.
It was four nays and 3 yeas.
So we're not.
For purposes of open meeting, we need to have a statement of who voted
right.
what vote. A roll call vote may be in order?
Yeah, roll
or
call
clarify?
Vote.
All of our votes are roll call, so yeah, let's...
I'm trying to see if there's a way I can open this back up. Okay. Nay was the mayor. Cindy Clay, vice mayor, voted nay. Fry voted yay. Tuttle voted nay. Blueball voted yay. Clendenin voted yay. Johnson voted nay.
Okay, thank you.
Other discussion on this ordinance, again, we can entertain, I'd like to make an amendment where, actually, I'll defer to Councilmember Johnson as I further clear my thoughts on the amendment. Councilmember Johnson.
Thank you, Mayor. One thing I definitely want to modify is Section 5. I would like to strike modified by the City Council by repeal or extension and add until August 11th, 2020, which is the second council meeting in August.
Section 5, give me a sec.
That was
Until modified, yes.
the issue we had of this just being effective until we figure out no. This would allow us to review in about 30 days.
And this was August
11th, it's the second Tuesday in August.
And just for clarification, if we find out COVID went away before then, we could just retire this before then. Making this August 11th would allow us to retire it before then if we chose to, or extend it later if we chose to. Is that correct?
You have authority to rescind the ordinance, amend this, or modify at any time?
And if we did nothing, it would just end on August 11th.
If this motion passes and the ordinance is adopted?
I will second the motion to add, to strike be in effect until modified by the City Council by repeal or extension, and add a retiring date of August 11th. Discussion on the motion. Motion has been made and seconded. Is there discussion? The chair recognizes Councilmember Tuttle.
Thank you. Can we repeat the motion? Is the motion to approve this ordinance with that recommendation of adding the date, or is the motion just to add the date? Do you understand what I'm asking?
Yeah, the motion right now is just to add the date. So trying to work this into something that we can look at a final version before we vote.
Okay.
So may I ask another question? So I think there are several modifications that if you are going to vote for this, you'd want to see. Are we going to do a motion for every one of those? I'm asking a question I don't know the answer to. There's no judgment in that. I'm just, do you understand what I'm asking?
Yeah, I'm fine either way.
I think the way that Councilmember Johnson has offered it, you will vote on each and discuss each one. Right.
And then the final at the end.
And then you would vote on the final as well.
Okay. So thank you for clarifying.
Yeah, and it was a compromise where my idea of recessing for 1 hour and having individuals be able to offer amendments and come up with a different document. Councilmember Johnson asked, well, let's just do it here. So I think this is the easier way to do it. So that is what we're into now. So with that, the motion has been made and seconded. Is there any more discussion on the motion? This will sunset the ordinance at August 11 if we took no other action. No further discussion. Members will vote on the amendment. Councilmember Bluebog, you may vote by voice.
Nay.
With a result of 6 yeas to 1 nay, the motion does pass. The only nay was Councilmember Bluebog. So now, this is as amended. Other, Councilmember Tuttle.
I think that was from before. Thank you.
Oh, apologies. Councilmember Clendenin.
Yeah, I would like to propose an amendment that Section 5, no, I take that back. Section 4, number 2, I believe it's number 2, pertaining to the fines. It says there's no discretion on whether or not a fine would be given. There it says shall be punished by if a person is seen not wearing their mask. That's at least the language in here. Mm-hmm. It's pretty firm. I'm just asking that we take number 2 completely away and not offer a fine, but offer an opportunity of education.
I'm sorry, Councilmember, this is section 2, which?
Section 4.
Section 4, 2.
Section 4, part 2.
So,
A person, firm, or corporation convicted of a violation of this section shall be punished by a fine of $50 upon first conviction, by a fine of $100 upon second conviction, and by a fine of $200 upon third or subsequent convictions. And are you looking to strike person, strike the entire paragraph, or change shall to may?
no, I'm asking to strike the whole paragraph.
Second.
Motion has been made to strike the entire section 2 paragraph. I would make a substitute motion that if we were to strike the section 2 paragraph, that we would add language about enforcement through education, as was discussed during by our police officers. Do I have a second to that substitute motion? And it would strike section 2, and it would add that enforcement is through education. So there would be an enforcement mechanism.
So could you wordsmith that for me so I understand exactly what you're proposing?
Yeah, I need more coffee. So the underlying motion would strike all of number 2, which would take out any fines. What I'm asking is that, and you're right, we would have to wordsmith this, and sadly the officer left because he had such an eloquent way of putting the 3 ways that they would prefer to enforce this. Perhaps I can defer the floor to the manager who's also elegant.
Yeah, Mayor, I think the department's on record regarding how they would approach this. So I'm not sure that you have to have language in there that says that they must educate. Okay. I think what I'm hearing from the council is if you adopt this ordinance finally, then that's the department's on record from the podium saying they will go ahead and educate. We'll also try to obtain masks, to help people in terms of compliance.
Thank you so much for that. And I guess that makes a lot of sense if the ordinance is silenced, then a policy would kick in, and the policy is to influence and utilize education. So I retract my substitute motion. I believe this motion was made and seconded. Was there a second?
Yeah.
Was I the second? No, it was Councilmember Fry. There's no more discussion. Oh, Councilmember Johnson has discussion.
I did, and then we started talking, and I think I lost it.
All right, we can get you, if you don't have discussion on this motion at this time. Councilmember Tuttle looked like she snuck on that list. I apologize before it's over.
I'm just trying to make sure that I get this right. So right now the motion is that we're just going to entirely strike 4.2, right? So there won't be any penalty. If somebody doesn't have a mask, there's no enforcement at all, is what's being proposed.
By ordinance, the enforcement will be, enforcement mechanism won't be determined by ordinance, but it will be by policy, in which the city manager eloquently pointed out that policy was related to us earlier through education and other means.
Can I follow up? Sure. I didn't hear the word policy before. I just thought it was more like that's what the police is going to try and do. A policy is a written document, and I haven't seen that at all either. So I just want to clarify. I don't think anybody mentioned a new policy within the police department. We were just saying that it would be our recommendation that we would have education. Am I correct in that?
No, Mayor, please. Councilmember Tuttle, as I understand it from previous discussions with the chief, as well as what the deputy chief represented today, there would probably be some type of enforcement guideline that would go out to the officers. Otherwise, they would not understand what the council's adopted and how we go forward. Yeah. So that would be something that we would do, is provide that enforcement guideline.
Thank you. I just want to make sure.
Mayor, at the risk of complicating this legally, I'm reluctant to add this, but for an ordinance to be an enforceable ordinance, there needs to be some penalty provision. It can be as probably creative as council wishes it to be, but that would need to be given some thought. We can't delegate the penalty provision to a third party, to the mayor or to the manager.
But it could be creative. So if we took this away, then we could actually, if this amendment passes, then we would have to put in a provision, but it doesn't have to be financial.
Legally, there needs to be some way to resolve the infraction. As it's written, it's an infraction. There needs to be some way to involve it. I'm just thinking off the top of my head, maybe proof of a mask or a fix-it type ticket, or I don't know. But those are some options. There needs to be some way to resolve the infraction.
Did you say that it would be to, something about a mask, I apologize, did you say to hand a mask, would that be?
Maybe present a mask or proof of a mask at a later time or something. I will leave it to others to consider.
Present a mask, what do you think, Councilmember Johnson?
I hate to muddy the waters on this. So I understand what Councilmember Clendenin is suggesting, but to Jennifer's point, maybe for an individual, the enforcement would be the presentation of a mask in education. But a lot of the concerns that I've seen on social media is folks within businesses. So whether it's a store or a hardware place. So if the individual infraction was education and presentation of a mask, but the firm or corporation kept the language in for to, is that doable? So it separates the individual from a business.
Sorry, I just didn't hear the latter part about the corporation, Councilmember.
So it would keep the language for 4.2 for a firm or corporation as it states, but for an individual, for a human, it would be presentation of a mask and education.
So I think the council member, and let me know if I'm clarifying this, we would have a substitute motion with section 2. Instead of striking all the language, it would strike person, and then an additional language would be added. A enforcement for a person in violation would be the presentation of a mask.
Yeah.
Is that inaccurate?
Okay, Mayor,
Please.
Councilmember Johnson, I think you're creating an enforcement difficulty for the department, especially if we put the language in there on presentation of a mask. I assume what you're saying is that we would present a mask, and then I'm going to have a supply of masks that's going to be much more significant than what we've had in the past.
Okay.
And what we're trying to do is obtain masks to be helpful, but I can't guarantee that all the officers that are on the street are going to have a sufficient number of masks to be able to present to violators. I'm also a little concerned that we have to tell our officers, you're not going to enforce against individuals, but you are going to enforce against corporations. And so now they're going to have two sets of standards they have to present. And then does that mean that that company has to have a policy in place? And I think it's, that's a little bit of a concern I have, because I now have two-tiered enforcement.
Would it be the same concern by striking the person?
I'm sorry?
Would you have the same concern if we just struck person from that? And we left firm and corporation?
Yeah, I'm trying to think if there's a better way.
Well, let me say, so this is where I'm going. And I probably should have said this. So I'm thinking about citizens have the freedom to be in our parks or outdoors where potentially it's a little safer because you can have wind blowing in different directions. And rather than having WPD approaching citizens out at parks and stuff like that, this would just focus on indoor businesses. And that's where I think a lot of concerns around clusters and just folks being in close quarters are. So if there was a report that there was, a business not enforcing this, then WPD could then, kind of like our nuisance ordinance, go talk to the business owners about ensuring that patrons are wearing a mask or not.
Right.
I think you're talking, if I may, about just omitting section 3 of the ordinance. And would that be?
You said section 3.
Section 3 would take all penalties off persons and just place them on the businesses.
That's a little more in the substitute motion, then that might be something. My question, and we can get back to Councilmember Johnson, you can retain the floor after, is if we are been successful with utilizing education and influence, and if we have masks, have any option to give a mask, which I think we can, without having it mandated through this. I wonder if we dropped the fines to something very small, if that would allow us to stay within the legal limits of a enforceable ordinance without putting an undue process, and then we could, of course, make sure that may is inserted instead of shall, which allows a credible amount of leniency, where the fine will only be enforced in most extreme situations. Would that, Madam, I was going to say parliamentarian, but now I'm asking you as the director of law, would that be suitable?
If the question is, can it be a minimal, modest amount, the fine can be any amount that you choose to set it. I think it shall needs to stay because there needs to be a penalty provision.
May doesn't preclude it from being a penalty, though. It just allows.
Yeah, but who decides?
Pardon?
Who decides on the may? When he says may be punished, who makes that determination?
It would be the enforcer. It would allow them to have discretion. How about shall or may? I've been on judicial committee. We've argued shall or may for about 5 hours one day. So, I get where we're going with this.
I understand this would recommend shall. Again, discretion can be used in the application of the education part, before it gets to a violation. This, I will point out, only talks about convictions. I mean, this is only when you get to a conviction.
Okay, so up until that point. So with that, I'll make a substitute motion that we drop the fine to $1, $5, and $10 with
in place of these current numbers?
In place of these current numbers. So instead of striking all the language, we would $1, $5, and $10 for first, second, or third. Since this isn't a conviction realm, it's not. By the time it gets to that point, we have already exhausted education and offering a mask. So if you can't afford $1, then you should take the mask.
Mayor, may I ask a question?
Of course, Madam Vice Mayor.
Thank you. I just want to ask City Manager a question. Would it cost us more to process a $1 fine than the $1 fine?
Right. Mayor, Vice Mayor, yes, the question is it will. Yeah. And if they're convicted, and City Attorney could correct me, I think there's court costs that'll be assessed as well. So that'll go above and beyond in that regard.
So they'd have to pay the court costs.
You'd have a fine of $1, but then they'd also have to pay court costs.
Court costs.
I wish I knew. I'm not sure for an infraction if they have to pay the court costs. I'm just not sure for an infraction.
Yeah.
Again, we have process in some, of our tickets. If they could bring the ticket in and show proof of a mask, and the prosecutor's office would dismiss it like we do with any other fix-it ticket. That's one option. There would be no conviction, then no fine.
That's what I was going to ask is.
I mean, that's the way the prosecution applies discretion in a lot of matters.
That's what I was going to ask. So not all these that would actually be prosecuted, right? Like the idea that we would go after someone for $1.
Or even if it was at $50, it's the last resort. The police department is looking at this simply as a last resort. So you're not even going to have a ticket issued or infraction noted unless we've been unsuccessful or it's a blatant violation of the ordinance, would be my guess. If we went down to the fees that you're talking about, I'm also probably going to incur the wrath of Judge Jones for bringing this through her court system.
Okay, well, my motion wasn't seconded.
Okay.
So the original motion is still on, which is just to strike all of Section 2.
But we can't.
Oh, we can. And we can implement it, and we'd have to go to court, and there would have to be damages for someone to challenge this. Even if legal suggests that we can't enact this without a penalty, we can. We just would have to go through the process. Maybe we could fix that part on Tuesday. But before, in the right time, we would actually have the ordinance in place. Does that accurate?
Is that the ordinance needs a way for the would-be violator to resolve the infraction?
Councilmember Tuttle.
Thank you. I know that originally I made the comment that I was worried about the fines being burdensome to our vulnerable populations, but upon hearing more clarification from our city manager that, we aren't just going to be running around slapping fines on people, that it's going to be the last resort in education. I do think that if you have an ordinance without enforcement, it's just a recommendation, right? And I also, Councilmember Johnson, you and I are probably going to disagree a little bit on this, and I'm sorry, but I do think it's personal responsibility. I was in one of my favorite retailers a few weeks ago where they require you to wear a mask to get in the door, so I know they're checking, but I see people walking around the store without masks because they get in and then they take them off. And so what if I see Councilmember Fry and he's not wearing a mask, and then, the retailer or the restaurant or whatever gets in trouble, they can't walk and hold everyone's hand. So I'm going to really push that we keep some personal responsibility if this proceeds, just because I don't think all of the responsibility can be on the businesses. They're trying to run a business and they're not public health professionals. So that part I'm going to push back, but I don't know if I want to make a motion until we have some more discussion, but part of me says, even though I had angst with 4.2, I'm okay with leaving it because it seems like the best option we have at this point. Thank you.
And I'll just, I don't know if I have a list here, so members, please get my attention because we have the roll open for this motion. The motion is to strike all of the language, which according to the legal department would put us in conflict in which we might be, we might have a problem implementing it without that. So I'm going to actually vote no against deleting all that language, and hopefully Tuesday we can come up with a resolution, because we can amend this on Tuesday, for this section. So the fines will stay in place since we just confirmed that they are the absolute last resort, that they are penalties at that point, to the point where defiance, given a mask, everything has failed, and therefore it's very rare that these would be put into place based off our previous experience. So right now the motion on the table is to strike all language. If we vote no on that, we can still go back and edit it or stay here. Council member, the manager for advice.
Thank you. There is no way I want the title council member right now. Thank you.
You got a seat up here.
Yeah. No, thank you. And this will depend on our partners across the street, but when they asked for an assessment of expenses that were COVID-19 related, one of the things we agreed to do was submit for reimbursement of mask purchases for low and moderate income residents in the community. If they look at that in a positive manner and we get that funding, then what we can do is make sure that those are available through the prosecutor's office. I just today can't represent that I'm going to have those masks, but if someone were to come forward, if you got all the way through this process and they were and they were ready to go to court and we were able to provide a mask, then I would assume the charges would be dismissed in that case.
We're kind of in a rabbit
It's up to the
hole.
it's up to the prosecutor, but I mean, there's a lot of discretion. I think you're gonna have to go very far before you'd even get to a point where someone's convicted and these fees, the fines would go into effect. And if we can supply them a mask or they show proof of mask, I think what the city attorney has said, then we would dismiss, in all likelihood, dismiss that charge. Again, depending on the circumstances of the case. So
if we keep this as is, then it's.
Ultimately, you have to feel comfortable with it, and I understand the concerns. I'm just simply saying I understand what the city attorney is indicating, that there has to be some penalties, and I think they can be mitigated to some degree.
Of course, and we got this saying in the legislature where you lawyer something to death, where you literally take a little thing like may or shall, and you just drive it into this hole for a few hours, and everyone gets tired. And I think that The intent is to make sure that we're protecting lives before 4th of July, which the medical community has expressed will have a huge bump. We don't want an undue burden on our population. And upon further discussion and review, it seems like the chances of an undue burden is really minimal, would have to go quite far. It won't be sprung on someone, is my understanding. So with that, the motion has been made and seconded. Is there further discussion on this motion to strike section 2?
Yeah, I'd like to offer a substitute motion
Thank
to
you. Go ahead.
modify section 4 to the fine amounts to 25, 50, and 100.
Second.
Substitute motion would modify the fine amounts from 50 to 25, from 100 to 50, from 200 to 100, is that correct?
Yep.
Divide them in half. Took me a second to realize that's what we were doing. Motion has been made and seconded. This is a substitute motion. If this motion fails, it falls us back onto the original motion.
Mayor, may I follow up on, the manager correctly stated earlier that there would be court costs on this. I was not sure but that it's an infraction, but there are court costs. So I do want to make that known before the vote, that it's correct as the manager said.
So any more discussion on substitute motion? See none. We have roll already open. Those who are in favor of the substitute motion, please vote. Councilmember Bluebog.
Mayor?
Yes, we're voting on substitute motion to.
I am watching the meeting. I cannot refer back to my notes. Could you please read to me what exactly is being changed?
Yes. The section 2, a person, firm, or corporation convicted of a violation of this section shall be punished by a fine of originally $50 upon the first conviction, by a fine of $100 upon the second conviction, and by fine of $200 upon the third subsequent conviction. The substitute motion on the floor is to cut all those numbers in half, so that the first fine is $25, the second fine would be $50, the third fine would be $100, and the discussion from the bench summed up is that we would likely go a long ways before anyone would actually have to pay these fines. Does that help?
So we're just striking that?
We're dividing the fines as printed in half, yes. Less burden on the people.
Okay, yeah, nay.
With a result of 4 yeas to 3 nays, the motion does pass. It looks like Councilmember Fry, Councilmember Bluebog, and Councilmember Clendenin are all nays. Councilmember Johnson. Nope, excuse me. Councilmember Tuttle.
That was from a long time ago.
Everything feels like it was a long time ago. Vice Mayor Claycomb.
All right. Okay, so I have another change to the ordinance that I would like to propose, but I want to talk this through and then I'll make a motion to make sure that I've got that. All right?
The floor is all yours.
So this is section 3, number 1, C. C like in cat. This is where it refers to all these medical facilities. It is still in conflict, I believe, with exemption number 3E. So is there a way to say obtaining services from healthcare sector in settings and this list, and then say with the exception, with the exemptions listed in 3E, or something like that?
Vice Mayor Jennifer Magana, one thing I'll point out is under C, the first C, under 1C, that phrase is modified by unless directed otherwise by an employee or healthcare provider.
So that would allow, if they were told to take their mask off.
I believe that that's a practical solution.
All right, I'll be fine with that. Thank you.
Excellent, very good question. Other amendments to this draft? See this? In section excuse me. Jennifer, if you wouldn't mind, section 3 down to I. And this is it says, persons engaged in an activity or event held or managed by the Kansas legislature. Is the Kansas legislature trying to exempt themselves from, would this exempt members of the Kansas legislature from an event they're holding to follow these CDC guidelines they're trying to put in place?
This was language similar to the governor's order, and that would apply to an activity or event held or managed by the legislature, so.
But only within Wichita.
I'm sorry?
But it would only apply within Wichita. So the original governor's order was probably for Topeka,
Right.
but because it was statewide. I'll make a motion that we strike I because I don't think members of the Kansas legislature should have power that supersedes individuals, and I don't think their cookouts should have any more any loopholes that they could exploit to not follow these guidelines than anyone else's. Is there a second?
Are you talking?
So section 3, page 4, I, in the governor's statewide, it says that the Kansas legislature, this seems like it is intended for if the legislature was to meet, and the language is persons engaged in an activity or event held or managed by the Kansas legislature. I don't want this to be interpreted as a member of the legislature doesn't have to follow this because no one should be above the law.
Second.
Motion is made and seconded. Councilmember Fryer, are you speaking to this motion or are you
Yes.
seeking the floor?
Yeah.
Councilmember Fryer.
So I guess my question is, how did this get inserted in this ordinance? Was this drafted and carried over by staff and just took the executive order and made all these changes to pertain to us?
Based on the direction received, this was generally followed that language.
Direction received by whom?
Mayor?
From the mayor?
I was the one who requested the drafting of this legislation.
Okay, and so all of this language came from you, correct? Is that what
No.
I'm hearing?
No.
But from the executive order and then tweaked to be for us?
This language comes from the executive order and is put into ordinance format, which is different. So that line would just strike what I think could be taken out of context. Obviously, the Kansas legislature isn't going to have an event here between now and August 13th, but I don't want legislators to think that they can have their own events and that they have a loophole. So that is the intent of my motion, and yes, I didn't dream up this language on my own. This stems from the governor's.
Right, but I guess what I'm asking is you put these in and now you're asking to take it out, correct?
No, I didn't draft this.
But when you carried over the executive order and put it in our ordinance form, you carried those things over, correct?
Our ordinance doesn't allow me to personally write legislation. Therefore, I directed the law department to go ahead and to create an ordinance like every other ordinance that comes from executive order to fit this. So are you asking questions about the motion I'm making, or
No,
are you
I'm
asking questions about what did I do to call
Yeah,
a
I'm just
meeting
asking how this language originated and that what was chosen to be put in versus what was chosen to be left out. Who made that determination? Sounds like you did, and now that stuff that you had put in, you're asking to take out. That's all I'm asking.
Yeah.
Okay.
No. The answer to your question is no. Other question.
Then who did?
The governor's order was the legal framework in which this came. The law department is the one who creates our legislation as our code doesn't allow it. Was this my idea? Yes. I'm also the one who called the meeting. Do you have a question about the motion?
We can move on.
Thank you. Other questions about the motion to strike I? See none, clerk will open a roll. Members cast the votes.
I still have my hand up for a question, Mayor.
Johnson, you should help me with that. Yes, of course. Question on striking I.
Okay, Mayor, I'm still trying to identify. And I believe this is part of the question. Can I get an answer as to who did author this proposal?
I
If it was
requested
not
their
you.
proposal, and the legal department authored it. They wrote it.
So Jennifer Magana and our team inside the city of Wichita drafted this. Is that correct?
Based on the governor's order.
So did
At my request.
Department. So did the governor have an influence on this? Did the
Not
governor's
directly.
staff have an influence on this?
No. The governor did not have an influence. Unless legal can dispute this, governor has not been in contact with any of us on this. We didn't run this by her. Any other question?
Nope, that's it.
All in favor of striking aye, please hit your button. All right. Councilmember Bubog, how would you vote on this motion?
Nay. Nay.
Excellent. With 4 yeas to 3 nays, the motion does pass. Aye is struck, and I think we're getting tired. Is there any other pending before? Councilmember Tuttle.
Can we clarify, if I may, can we clarify the votes for the record? Who are the yeas and nays?
The nays was Councilmember Bubog, Councilmember Fry, and Councilmember Clendenin, I believe. Councilmember Tuttle.
This was something that Councilmember Johnson brought up, and I also had just a question about is section 2 and then 1 and then A. It says inside any indoor public space where distancing 6 feet at all times is not possible. I wonder if we can just somehow revise it to say if you're more than 6 feet away from people, your mask can be removed. I don't know, it just seems a little clunky to me that way. And, you know, if I go to a restaurant and I'm more than 6 feet away, I want to be able to take my mask off, right? But, I mean, it could get a little wonky, I know, because if you're in a restaurant, it's different than if you're in a retail and you're walking around. So I'm fine with it either way, but Councilmember Johnson, I know you brought that up before, so I just wanted to make sure we got it addressed. And maybe, you know, we could wordsmith this thing until next Tuesday and never leave. So I'm fine either way, but just crossing off my list and wanted to hit that one as well. Thank you.
Councilmember Johnson, by your name being mentioned, she defers you to the floor. Would you like to respond to that?
Yeah, I still don't have a solid suggestion on my end, just something to still think through.
And Councilmember Tuttle, my apologies. Can you tell me which section that is? I thought I had it, and I don't think I did.
Section 2, 1, and then little a. It's at the second line from the bottom on page 2.
Yes, ma'am.
That's section 3, actually.
Oh, my bad.
Yeah, I think I confused you because I wrote it down wrong. It was
Sorry.
section 3, 1A.
Oh, yeah.
Sorry about that.
Okay, so where social distancing isn't possible, they would have to have a covering while inside. Councilmember Fry.
So this goes back to my last line of questioning, because in section 3, points 1A and point B differ from the governor's executive order. So the language was changed, and I'm trying to understand why it was changed, because the governor's executive order says in 1A, inside or inline to enter any indoor public space. But then in our version, we added additional language.
I can answer that if I may.
That'd be helpful.
The legal staff, I got input from another attorney in the office today and said that try that language. We're not tied to that language. It was just a suggestion for drafting.
Okay. Thank the department for cleaning it up. Further questioning? Councilmember Claycomb.
I just want to help clarify maybe. So that section 3(1)A, I think the exemptions help cover that because it talks specifically in the exemptions 3F about restaurants. So if you're in a restaurant, that's an exemption to 1A. And if you're an athlete, there's an exemption. And so I think that helps. It's kind of clunky, but it's not every one of these inside any indoor space, because you have these exemptions later. So.
Which is common legal, but not common. So, and if we are able to pass this, I'm sure that we can create a memo to help clarify the implication of this. I'm sure that's what we normally do. Is there any other discussion on the ordinance as amended? Councilmember Johnson.
Thanks, Mayor. Also a great catch, Vice Mayor. Just one question of clarity. I think I'm good with everything else at this point, but for G, under the exemptions, the athletes who are engaged in organized sports activities that allow athletes to maintain a 6-foot distance from others with only infrequent or incidental moments of closer proximity. Reading this, thinking about youth football, who is probably out practicing right now, and you cannot, for the most part, maintain 6 feet in football because it's a contact sport. Does that mean that if they are out in any way, shape, or form organized practicing right now, they need to wear a mask?
I believe athletics is exempted, is that correct?
No.
Like exercise is exempted?
No, that's what he's reading.
Okay. That was somewhere else in this.
So this would be like a 3-on-3 tournament, maybe even basketball is close contact, so.
Yeah, this is a challenge in drafting when you get into the specifics. If there's alternative language to offer, that might be appropriate, but it would be a challenge factually to determine this.
Can we utilize some language, perhaps, Johnson, I apologize for taking your time here, perhaps language that excludes exercising?
Exercising, yes. I actually don't think if youth football is out there, they should be in close contact right now because of the spike. I just wanted to get that on record I know there's a few coaches watching right now. So if this is saying that they should not be practicing at this point because they would need to wear a mask and it's not wise to play football with a mask.
No, that's exempting them.
And we could, when you get feedback, we could obviously make a change on Tuesday if we needed to as well.
Good point.
Vice Mayor Claycomb.
I just want to follow up on that. That does make me wonder, I know this definition of mask came from the executive order, but and maybe it's in here, and I'm reading this on the fly again, but in terms of football, I heard this morning on a news program about they're looking at face shields for some sports instead of having to wear a mask on your face. And those wouldn't necessarily have ties, straps, or loops over the ears or be wrapped around the face. But that might help with some of those. I mean, there's a cost, but it might help if there were teams or leagues that decided to use those. I don't want to exclude them. So maybe legal could speak to that.
And these are only sports where you're within 6 feet, I believe.
Right,
so.
right, yeah.
So could this be accomplished by broadening the definition of attached to the, or wrapped around, secured to the head?
Secured to the head.
Yeah.
And so let's just take that just a little further. So that means that if they had a helmet and it had a face shield attached to that, that would be considered secured to the head.
I think the key is covering of nose and mouth in my mind. So
The ears, right?
Why doesn't have the floor? Councilmember
Yeah.
Fry, Chair recognizes you. I apologize, Vice Mayor. Go ahead.
No, I'm sorry, I was muttering to myself.
Okay, so I would like to make a,
Of course. My apologies.
No,
I
that's
did
okay.
I thought someone was jumping on the floor, and I know
Yes,
it's
yes,
running
I
late,
know.
and I apologize. You have the floor, madam.
thank
and I
you.
apologize.
So I would like to move that we add to the definition of mask or other face covering, which is definition A. Oh, you're saying it, that because but it says secured to the head with ties, straps, or loops. Sorry, now I'm deviating here. Just because it says secured to the head, you think that will cover it, Jennifer?
I don't know, I guess, I don't know what's out there, or you could say secure to the head with tie straps or loops over the ears, or other means.
Other device.
Yeah, let's do that. All right, so I will move that we add, or looped over the ears, simply wrapped around the face, or secured to the head by some other method.
Second.
Thank you.
So the motion, I believe, is to add or some other means in context to securing masks to the head. Therefore, there could be adaptation of football helmets and other close contact sports so our kids can still play while being safe. Is that inaccurate?
Yes, thank you.
Of course. Any discussion on that motion? Motion for the amendment, excuse me.
I've had my hand up for a while, Mayor.
Oh, move on.
Let me see if I can figure this out. I apologize. So Councilmember Johnson has been helping me with this, and my computer hasn't been working. So please, we're discussing the amendment for, we're discussing the Vice Mayor's amendment. The floor is yours, Councilmember.
Thank you very much, Mayor. Just trying to get a good understanding from my years of coaching junior football. So you can line all these kids up, no 6-foot distancing, but they've just got to have a wraparound shield on their helmet. Is that correct?
The motion will allow for that option, for an option so that kids' football teams could get creative and implement a device that's connected to their helmet that also protects them from COVID, yes.
But they do not have to?
No, they were
voluntary?
If they were going within 6 feet of each other, then they could have this option instead of a mask or instead of any other type of covering, yes.
Okay, but they're going to have to be within 6 feet of each other to play any kind of football.
If they were playing games between now and 30 days, this would allow them an option to play games, yes. If they're just practicing, I'm not a football coach. I don't know, maybe Johnson wants to jump in on this, but because I know that he's received feedback from football coaches, but I'm trying to relay the concerns that I hear there.
So my understanding of this would allow for a team to practice and play as long as they have a face shield that's secured to their head or some other method or device.
Which is what the coaches, you feel would ask for?
Yeah. Well, because right now I don't see it. So this to me would allow that in a safe manner because I've driven by and just seen young people with nothing on in close quarters. So this would encourage more safety.
Other questions?
Can I just quickly?
Actually, we're discussing the motion right now, and so only members of the body can speak to a motion, but we can ask you for clarification questions. So there's a fine line with debating, and then I apologize. I'm sorry.
No need. I'm out of order.
No, you've been great, and I apologize. All right, is there any more discussion on this motion? See none, clerk will open roll. Members cast the vote. Councilmember Bluebog, you may vote by voice.
Nay.
With a result of 4 yeas to 3 nays, nays being Councilmember Fry, Councilmember Clendenin, Councilmember Bluebog, the yeas have it. Councilmember Tuttle.
I honestly cannot tell you where in here, but I'm just going to bring up one more concern that I've heard from my constituents during the last almost 24 hours since this has started, is that if I am at a workplace, and our council offices are here, our city offices would be a fine example, where I'm in my office alone and I'm working away, can I take my mask off? It seems like a very reasonable thing, but somebody could walk into my room and then, we can stay 6 feet away. But I'll be honest, I sure would not want to have to wear my mask in my office when I'm sitting in there alone. So I don't know exactly where that needs to go, but I would really like to have that discussed.
My understanding, and legal can help me with this, is this applies in the workplace if the business is in frequent contact with and open to the public. So if someone was in their office and that office space is not open to the public without going, through some channels, I believe that's covered, but maybe legal can help me with that.
I believe there was a provision in the order that talked about that. This is just stating that employees in any space visited by customers or the public, regardless of whether anyone from the public is present at the time. So any space visit.
So Jennifer, can I just clarify? So let's say you're, I don't know what, but I can't think of an exact example right now, but you're not really in an office where the public comes in, but other people can come in. Does that make sense?
Like our council office.
Like our council office. Thank you. Thank you for bringing it back to me. Yeah, or Bob's office or your office or whatever. The general public isn't just going to come walking in. Hopefully not. But in this environment. But your colleague may. So can you take your mask off then?
Well, you would look at, I think you look at 2D, employees in any, I'm sorry?
2B.
2B, okay. Got to order, sir.
No,
Thank you.
That's food. 2B is food.
2D would say employees are in any room where other people are present. So I think if you're in the office alone, that would seem to imply someone has to be there.
Okay. I just want to make sure as confused as we are all right now, imagine the community trying to digest and interpret this. And so I know that's a question that so we thought we got a lot of emails last night, ladies and gentlemen. The games are just going to begin with that. So I just want to be able to make sure that when people, they're going to ask that question, I know, and I would too. So I just want to make sure that I know the answer clearly.
And I think Dee does discuss are present and are unable to maintain 6 feet distance except for infrequent or incidental moments of close proximity. And I think infrequent and incidental moments of close proximity allow kind of a common sense grace period or grace. Vice Mayor Claycomb.
Thank you, Mayor. So I want to continue with this line of questioning that Councilmember Tuttle is talking about, because 2A says that employees are working in any space visited by customers or members of the public, regardless of whether anyone from the public is present at the time. So to me, that would, going back to the example of I'm working in my council office, I have to wear a mask?
Well, this talks about visited by customers or members of the public, so I guess that's a question of fact.
I'm so sorry, but it's section 2B, please.
It is, yeah, we got it though. My understanding is
section 2B
is A, B, C, and D. It eventually starts, and D allows you to negate. I think your concern where A is not standing by itself. So the section adds language to clarify. I think what your concern is that obviously. You don't have to wear your mask when no one's in there if you can social distance. It would be very similar, I think, to the policies we have in place here.
So I'm not so concerned about me. I'm concerned about people out in businesses. Is that true that those negate each other?
I'm not sure that they do. I think you stand alone employees working in any space visited by members of the public or customers. At all times, is what I would, the way I would read it. Yeah. So that may be something to consider.
Yeah.
Okay.
Mayor, could I ask for the doctor to add clarification to this?
I'm not sure if he wants to.
I think he does.
I'm not sure if he's.
Your camera's still on. Your camera's still on.
Yes, we will allow the vice mayor to defer to the medical expert who seems interested in giving some clarity to this.
I am so sorry, and I hate to be, a medical expert is reaching, but what I did notice is what I'm trying to just point out is in the document, if you go to page 4 of the document, so page 4 of the document, we have a whole bunch of whereases, as typical legalese. If you go to section 2, so all caps section 2, and then you drop down under definitions and you drop down to B, public space is defined as means any indoor or outdoor space or area that is open to the public. This does not include private residential property or private offices or workspaces that are not open to customers or public visitors. So, I mean, even though, yes, technically someone can visit your office, I think that it's implied that this is a private space.
So a difference there between like a coffee shop and where lots of people are coming in and out, and a office where, of course, you're not forbidden from visiting someone, but it's not technically, in the spirit of this ordinance, a public space. I think I understand that.
That's all I was trying to point out, and obviously we would defer to your legal counsel, but that's that. I just wanted to call your attention to that one spot.
We appreciate it.
Thank you, Doctor.
Councilmember Johnson.
Thank you, Mayor. No suggestions. I just wanted to say I've appreciated this dialogue today with all of my colleagues and making sausage from the bench, because it doesn't happen often, but this was a great conversation. And I know that many of us were a little frustrated by only having 3 hours to review this document, but this has been a good discussion thus far. And I think that we have been making progress even through some of our disagreements. So I just wanted to say I appreciate it.
Thank you. Councilmember Tuttle.
Thank you. And I know we'll have to make a decision here soon, but I just want to state it now, and I'll probably state it again and again and again and again. So I'm sorry, Mr. Layton, but here it comes. While this is hard work, the harder work is going to be communicating this in a really effective way to the community so that they understand this and they know what they're going to do and not going to do. And I think that we not only need to think about how do we communicate it with, businesses and organizations across the community, but we also need to do it in a way that's concise and able to understand. Nobody understands all the legalese. And then also consider multiple languages, also blind and visually impaired. We're going to have to, the hard work isn't ending when we walk out of this room. I think the hard work for staff is just going to begin. So it's going to be really important for me to know that the community, probably something on our website with frequently asked questions, I don't know, and smarter people than I am will certainly figure that out. But that is something that I'm significantly worried about, is that, somebody may not even know this happened. How do we make sure that it gets out to the community so that the people are able to follow it if it passes? So that's a concern that I'm going to have, and hope. I'm going to hope for the best, but I think, like I said, the hard work is just beginning now.
Other questions or discussion on the legislation? Seeing none, I'll make a motion to pass the legislation now. As amended.
Mayor, it looks as if Councilmember Bluebaugh's hand is up again.
Oh, please don't tell me that, because I missed Councilmember Bluebaugh.
Thank you, Bob.
Yeah.
Thank you, Bob. Councilmember Bluebaugh. My apologies, this is not on purpose.
Actually, Mayor, it was my fault that time. It was left up from last time.
I didn't know Bob could see you on this, so I could blame him for this. But yeah, go ahead.
It was actually left up from last time, Mayor.
Oh, it was left up from last time, yes. Thank you.
Yep, I have no comment. Thank you.
With that, I make a motion that we pass the ordinance out as amended. I normally would make an argument on why we should pass it out, and to be honest, I think that I'm really proud of it. And we've talked to 16 people who are in favor, one person who was not in favor. I think that we've heard enough about this that we can make our own vote. So I'm just going to keep it short, and I make a motion. Is there a second?
Excuse me, if I may. There's the question of the emergency declaration. If this is deemed to be effective today, there needs to be a motion to adopt the emergency declaration as well as the ordinance.
That's why we keep Jennifer
And
around.
can I ask a point of clarification, since you said that? So when you say if this passes in the emergency declaration today, is that today at 5:50 when we make the vote, or is it today at really tomorrow at 12:01? I mean, not to get in the weeds, but logistics matter.
The ordinance would suggest today at this time.
At the time that we pass.
The time of the vote.
with that, I would ask, my motion wasn't seconded, so I will make a new one, that we pass the ordinance as amended along with the declaration of, is it of disaster?
Emergency.
Of emergency, so that this can go into effect. Is there a second?
Second.
Motion has been made and seconded. Any discussion on said motion? Seeing none, clerk will open the roll. Members cast the votes. Councilmember Bluebog, you may vote by
Nay.
by voice. With a result of 4 yeas to 0 nays, the motion does pass. The nays were Brian Fry, Councilmember Fry, Councilmember Bluebog, and Councilmember Clendenin. I make a motion, we adjourn. Is there a second?
Second.
I mean, please don't keep us here. Is there a second?
Second.
Motion to adjourn, second. Were there any comments? We have the motion, we have a second. Is there any comments, or I think people want to say you're technically speaking to the motion, but I don't want to cut this off short. I'm just tired.
Well, I do have a comment.
Councilmember Clendenin.
Yeah, I do want to ask that we formally request that the Attorney General give us an opinion on our authority in this situation.
Noted. I can't thank staff enough for being here. I can't thank the council members enough for being here. Thank you so much. This, I think, is so important to our community. We cannot go to another shutdown. Our kids deserve school, and I feel like the worst dad in the world. I was on the phone all night last night, and my youngest, my wife said, needed to see me. And by the time I got in there, because I was on the phone working with legal and working with the public on talking about this, by the time I got in there, he was asleep. And I remember going in to my oldest son's room, who was on the top bunk, and he had his nightlight on and was clutching his Rover. And I told him that I was sorry for being a bad dad. And he told me that you're just doing what you're doing. This is what you do. You're not a bad dad. And I felt that even though I think that we cause a lot of disruption to the members here and to our staff, that I think I would have been a bad dad, and we would have not done our duty if we didn't ensure that our kids could go to school. And I think that I would have been a bad mayor if we didn't do everything we could to protect our city from what is happening nationally. So again, from the bottom of my heart, I can't thank you guys enough, and I apologize for the inconvenience. With that, I move my motion. Clerk will open the roll.
Can I get a vote from?
Yay.
Yeah.
With a motion of 7 yeas to 0 nays, the motion does pass. We are adjourned. Thank you.